Honorable Shiro. Good afternoon.
Oh, good afternoon to yourself, members and staff members all.
Honorable Sine, good afternoon to you. Okay, I see Honorable Kumalo. If you can quickly rename your gadget, please. Honorable Kumalo.
Good afternoon, Chairperson. Good afternoon, Chair, and all honorable members that are in the platform and our officials. Thank you.
Can you try to rename your gadget, please?
Myself?
Yeah, rename your gadget.
Oh.
Then Honorable Clark, I see you are here.
Yes, I am. Good afternoon, Chair, and good afternoon to the members.
And then Honorable Shawangu, I see you are here.
Good afternoon, Chair and honorable members. Thank you.
Honorable Mutuvate, I saw you are here.
No, thanks, Chair and members. Good afternoon.
Okay, whom did I miss?
Chair, you missed me, yes, Dr. LaRue.
Oh, yeah, you are here. Honorable.
Good afternoon, Chairperson Songo.
Oh, you are here too. Welcome.
Yeah. Yes.
Okay. Honorable Dr. Liru, you are here in the meeting.
I am the Chair. Good afternoon, and good afternoon to all the officials on the platform.
I can see Honorable Mujadu is also here in the meeting.
Good afternoon, Honorable Chairperson and honorable members.
Welcome. I think I've covered all of you. Is there anyone whom I'm missing? No. We definitely do form a quorum, Secretariat. Am I wrong?
Yes, Chair, we do form a quorum. Thank you.
And do we have any apologies? Honorable Lekape, can you mute?
Good afternoon, Chair.
Yes. Can you also mute? Okay. We don't want to hear your conversation out there, or you are in the meeting. Do we have any apologies? Honorable Mujadu, I've seen you are here, Honorable Mujadu. Good afternoon. Honorable Mujadu.
Good afternoon, Honorable Chair, honorable members. Good afternoon, everyone who's here in this platform.
Okay, thank you. I was still checking. Do we have any apologies, Secretariat?
Yes, Chair, I've received apologies from Mr. Van Staden. Ms. Clark and Dr. Litlape will leave at 6. Mr. Zungola will join the meeting later as he is traveling. Ms. Sine will leave at 8:30. Thank you, Chair.
Okay. We should be done by 8:30. Honorable Mtuvaze, good afternoon.
No, afternoon, Chair. No, I just wanted to indicate that I will from time to time be in and out, but I'll notify you when I come back.
Okay, thanks. That's in order. Let me do the roll call for provinces. Then I'll call you by province. Then I know I've seen majority of the MECs are here. So I'll expect them to shout they are here and then also introduce their delegations. I'll start with KZN. KZN.
Good afternoon, Chair. It's Mrs. Simsibango, the HOT. Let me just check if MEC has joined, but I am here.
So the MEC just alert her that she needs to join the meeting. because I'm calling for
Okay.
MECs to introduce their delegations.
Okay.
Gauteng,
Good afternoon, Honorable Chair. It's Darian Balkri and the acting HOD. The Gauteng team is here. I am with the MEC, but she's just struggling to join. MEC Mazibuko should join shortly. Honorable Chair, thank you very much.
okay. Western Cape, Western Cape, no one. Free State,
Good afternoon, Chair and honorable members. My name is Ernest Mohlahlo, the HOD of the department. I'm joined with a team from finance. I was trying to check if the MEC has joined. He indicated that he's joining. Thank you, Chair.
okay. The Northwest,
Good afternoon, Honorable Chair. Tami Matsiko here, the HOD. I'm also trying to check the MEC. I think he's traveling. He will join also. I am with the entire team of executive management, Chair. Thank you.
okay. Northern Cape, Northern Cape,
Thank you, Chair. Here speaking is the head of ministry in the office of the MEC. MEC and HOD are together currently trying to log on. They are just facing a bit of technical challenges, but the entire executive is with them in the same boardroom, Chair. Thank you.
Mpumalanga,
Thank you, Chairperson. I'm here, MEC Mazini, with the HOD and the team. Thank you.
Limpopo,
Thank you, Chairperson. MEC Mashiro. I'm with HOD Dr. Ndwamatu and the team. Thank you.
okay. Thus far, we have got 2 MECs in the house. That's whoever's microphone is on.
MEC Mazibuko is in the house.
Sort the sound, MEC Mazibuko, so that we don't have echoes.
House.
Oh, lucky you. The train was about to move. I was going to allow the MECs that are here to first present.
No,
Lucky you are here.
I'm presenting after KZN.
Eastern Cape,
Yes, I'm present, Chair, together with the executive management as led by the HOD. Thank you very much.
you are present, and where's your report?
I guess it has been submitted
When?
not so long ago.
Seriously, MEC? Seriously? Now we'll talk to it when we come to that. Okay. KZN is the MEC here.
She's trying to join, Chair. She's trying to join.
MEC Mazibuko, definitely you are ready, ne? You'll be the first one to start. The HOD will indicate to us if the MEC is in, then we'll deal with that. But before that, let's fly the agenda quickly so that we can start the meeting, colleagues. So that's our agenda, and that is how it's going to go. In the absence of the MEC for KZN, Gauteng will be the first one to start, followed by KZN. Yeah, in that order, until we finish. We are at your mercy, dear colleagues, the MECs and the team. If you respond to the questions, we can finish this meeting earlier. Then, yeah, we can do that. But I must say this upfront in welcoming all of you. that this committee is convening today to receive a briefing from the National Health Laboratory Services and yourselves as the 9 provincial departments of health on the outstanding provincial debts owed to the NHLS and the implications thereof for the functioning of the public health system. I think one must raise this in the presence of you MECs as political heads, that the NHLS remain one of the most critical institutions in South Africa's healthcare system. Its services are central to disease surveillance, diagnostic testing, outbreak response, HIV and TB management, forensic pathology support, and broader public health interventions. And then the sustainability and operational stability of the NHLS are therefore matters of national importance, particularly for the millions of South Africans. You know, the majority of them are the most vulnerable, the poorest of the poor, who depend on these public health care services. I must say upfront, MECs, that we are deeply concerned about the continued accumulation of debt owed by provinces to the NHLS and the effect that this may have on the institution's ability to deliver essential laboratory services. Persistent non-payment or delayed payment raises serious concerns regarding financial governance, budgeting, intergovernmental coordination, and ultimately the continuity of quality health care services. And this non-payment as well, do they have far-reaching consequences for healthcare delivery, particularly for the vulnerable and the underserved communities that rely heavily on the public health system? The key consequences thereof, they include delayed or disrupted diagnostic services. You all know that the NHLS provides essential laboratory testing for priority diseases such as TB, cervical cancer, HIV, diabetes, and can assist us with emerging threats such as mpox and hantaviruses. These non-payments can lead to reduced laboratory capacity and delays in processing of the test. This compromises timely diagnosis and treatment initiation. And you must all bear in mind that our poor people cannot afford the private health sector services. Also, the other consequence of this is poor disease control and increased transmission. Delays in diagnosing communicable diseases that I mentioned above can result in ongoing community transmission, late treatment initiation, increased mobility, and preventable death. And then also, you all know, this also will have a negative impact on maternal and child health. You know, the pregnant women and children with no medical aids depend on routine laboratory services for antenatal screening, any early infant diagnosis, and monitoring of the infectious and nutritional conditions. Therefore, service interruptions may worsen maternal and child health care outcomes. And then as this delay is like that, the increased healthcare, then it will still continue to perpetuate inequalities. Vulnerable population in rural and low resource communities often have limited access to private healthcare alternatives. When public laboratory systems are weakened, these communities experience disproportionate barriers to diagnosis and care. And then also this, you not paying, it also leads to overburden healthcare facilities, because then clinicians, they are therefore forced to manage patients without confirmed laboratory results, leading to empirical treatment, repeated clinic visits, prolonged hospital stays, and increased pressure on already constrained healthcare services. And then also, with regard to this issue, you will also notice that the NHLS data are critical for disease surveillance, outbreak detection, antimicrobial resistance monitoring, and public health planning. And then financial instability to the NHLS then can weaken national health security and preparedness. And then this also has an impact on research, training, and innovation because the NHLS supports academic institution, medical training, and research collaboration. So financial challenges to the NHSL may also disrupt research activities, postgraduate training, and innovation in diagnostic and public health. So I'm raising all these, dear colleagues, in the form of MECs, so that you can also then understand and appreciate the extent this issue, the extent these non-payments are having impacting on the operation of the NHLS. So that's why we are saying today's engagement is therefore important, not only from a financial oversight perspective, but also from a service delivery and public health perspective. The committee is expecting from your good self a frank and a constructive engagement on the extent of the debt, the factors contributing to the accumulation of arrears, measures taken to address outstanding balances, and the plans to prevent recurrence. We are equally interested in understanding the operational impact that those outstanding debts have had on the NHLS itself, including the effect of turnaround times, procurement of laboratory supplies, maintenance of equipment, staffing pressures, and the institution overall financial sustainabilities. To the provincial departments, the committee expects clear explanation regarding the causes of the debt, the status of payments made to date, and the concrete timelines for the settlement of the outstanding amounts. We also wish to understand what interventions are being implemented at the provincial level to strengthen financial management and to ensure that the laboratory services are prioritized appropriately within provincial health budget. This meeting must also assist us as the committee in determining whether current situation poses risk to healthcare delivery and whether further oversight or intervention may be required to safeguard the functioning of the National Health Laboratory Services and the broader health system. We also want to appreciate your attendance, in particular you, the MECs, as the heads of the delegations. I realize we are full house with those ones that are still trying to join. And to you, MEC Mazibuko, we want to welcome you to the team as you are the newly appointed MEC for Health. It's just a pity you are inheriting something that but we believe in your leadership that you'll be able to resolve this issue. Having said that, I want to welcome all of you. I was dealing that with the roll call, then I omitted the team from the NHSL because I was trying to also check the presence of the provinces so that we don't then just sit here whereas the other provinces are here. Can I ask the chairperson, stroke president of the NHSL, the chairperson, Prof. Mpatlele, to then just quickly introduce your delegation. Then, from there, you'll be able to start with your presentation so that we don't waste time. Then immediately when you are done, then I will allow Gauteng to present. The MEC has also requested that she wants to go somewhere. Then the absence of the MEC for KZN has given her a broader advantage to finish first. Over to you, Professor Mpatlele.
I'm present, Chair.
Oh, you have arrived.
Yes, I'm here, Chair.
Okay. You'll come after Gauteng. Chairperson Mpatlele, over to you.
Yes, thank you very much, Honorable Chairperson, and good afternoon to the honorable members of the committee, as well as the representatives of the various provinces present. Maybe I should also convey our greetings to the National Department of Health. I see Dr. Anban Pile has joined. So, Chair, I think without any waste of time, from our side, we appreciate the opportunity to present the agenda item as you comprehensively given the context is all about provincial debts owed by owed to NHLS, and the agenda obviously is focused. And from my side, I don't need to do any preface. We appreciate the way you have given the context. And also, because we don't have enough time, I will just introduce the members. So with some of the board members and the names that were given, I know that Prof. Craig Housam, the deputy chairperson of the board, is present. I saw his name. Then there were the other names given from the board, Dr. Tebogo Muji, board member, then Advocate Matefo Majudina, board member, Dr. Rendani Chitangano, board member, Dr. Mahlane Palani, board member, and Ms. Fulufelo Chikodo, who is independent member of the Audit and Risk Committee. And that is all from the board side. And then the management, we have got the CEO, Prof. Koleka Mlisana, and she will basically do the presentation, and she might invite the CFO, Ms. Pumeza Mayekiso, but it might be that there are other, executive members present. But the two key ones will be the CEO and the CFO to do the presentation. I think I can pause here and then invite, with your permission, Professor Koleka Mlisana, the CEO, to start. Thank you, Honorable
Thank you, Chair.
Chairperson.
Thank you, Chairperson. Over to you, Prof.
Good afternoon, Honorable Chair, together with all the members of the Portfolio Committee of Health. I'm just trying to see, I'm not able to share, Chair, if I can be given sharing. I see it only says host only. But otherwise, I also want to just appreciate and greet all the provincial MECs of health who are in this meeting together with their teams, as well as the National Department of Health. And as already stated by the chair of our board, we have got all the executives, connected, Chair. I still cannot share. I don't know if somebody can assist me here.
You have the co-hosting rights, Prof.
It says who can share advanced.
I've also granted Ms. Mayekiso.
Okay, let's try this. Okay, all right. Thank you. I've got it. If Madam Chair, you can, or you can confirm that my presentation is visible.
Yes, it is, Prof.
Thanks, Honorable Chair. So we really appreciate the opportunity given to us to share our presentation. And as already stated by the Honorable Chair, it is really quite obvious, and I know we have been talking about this debt that has not been paid by the provinces. So what we are really just going to look at is to specifically just look at our mandate as the NHLS, which has already been highlighted, what our strategic focus is, and wherein the financial sustainability comes in, how our revenue is structured. Then I will ask the CFO to come in and do the debt analysis, and we'll then share key recommendations for the committee's consideration. So basically, Chair, if we look at our mandate, which is already, mentioned and highlighted, is diagnostic pathology services to the public sector, of the country, and that covers more than 80% of the population. We definitely support research as well as teaching and training, that's related to pathology. And how we deliver this is through our, various diagnostic labs that are throughout the country. We have more than 233 laboratories across the country. We also have got the forensic chemistry laboratories, as well as the specialized institutes, which is NICD, that looks at disease surveillance, outbreak response, and looks after the National Cancer Registry, as well as the Institute for Occupational Health, which looks at occupational health risk monitoring and workplace health safety. So our strategic focus, we've summarized it into these 10 points. And Chair, just to highlight that for today's focus, obviously, we are focusing on the financial stability amongst everything else that we do. And therefore, I will not, overlabor that point. And when we're looking at the risks as well that we have come up as an entity, the inadequate collection and non-payment of bill services is one of our critical risk areas. And it just shows, the importance of where these things, where the poor payment of debt, is quite prioritized within us as an entity. Where do we get our revenue and the various sources that we get our revenue from? So 89% of our revenue comes from the tests that we provide and we do for the provinces. And for the year 25-26, it's just over 12 billion rands. And then 5% is received from the National Department of Health grant. And this grant covers the NICD, it covers the NIOH, it covers the FCL, which is the forensic chemistry labs, as well as teaching and training and research grants. So all of that is covered in the 626 for 25-26, 626 million rands. And then we do receive a bit of income, from our bank balances, depending on where we are sitting. And then there is a small portion that we receive from the various institutions, academic institutions, wherein we provide teaching, at undergraduate level. And that constitutes 1%. And then any other, extra income, this would either be grants or, from various sources, it contributes 3%. So the total revenue for this financial year that we've just closed was, came to about 13.7. And I think, the next, this diagram just shows the different percentages from the various sources. And Chair, we thought, one of the first things that we will highlight is that we also, have our tariffs, and which are, every year we submit a tariff increase to the Department of Health, because our tariffs have got to be approved by the Minister of Health. And this just shows, our performance, over the last 8 years. I think it takes us up to about 8 years. And you can see that the first, a row is looking at what we have submitted and requested to the department. And the row below is what we have received. And you can see that we usually receive less than the requested tariff. And then if we look at the debt, Chair, before I call the CFO, so obviously the failure of provincial departments of health to settle, the invoices within the prescribed 30 days, apart from the fact that we end up with such long debtors days, it obviously places the entity at a serious financial risk. And we have made efforts. And I do want to say upfront, Chair, that there are ongoing discussions and conversations with all the provinces that are not paying as they should. And we have started engaging with them, for quite some time. And in fact, right now, and I'm sure you will see, when they present, there are certain provinces that have come up with proposals. And so this is all work in progress. And in fact, the last province I was talking to, a few days ago, we're just saying, for us, we're hoping that when we meet and we look at how the provinces are going to service their debt, our request is that if we can just keep, to those commitments, because a lot of times you find that we do engage and then there are commitments made, but those commitments are not honored. Obviously, this poses a huge risk to us being able to deliver our mandate. And Chair, you have already highlighted this very efficiently and very well. So it is therefore following this that we are putting this presentation, and we are going to be taking the committee through from a trend from 2010, 2011, right up to the present. And Chair, may I then ask Ms. Maegiso to come and present the figures, and she will take us through the various figures just to see where the provinces are sitting. Thank you. Phumeza.
Thank you, CEO. May I maybe start by greeting the honorable members and the chair, the MECs, HODs, and the rest of the colleagues that are in attendance this afternoon. So the first presentation, or rather slide, that we've included in respect of the finances, Chair, just speaks to the amount that has been paid in respect of 25-26, since it is the recent year, where we are indicating that the volumes in terms of the volumes of tests that the NHLS paid for is the 118 million rand. And the expected revenue was 12.9, and then the billed revenue was 11.9 billion rand. And then in respect of that, we then have received just under 6.3 billion rand, which is an equivalent of 53%. This then means effectively that we still have, on top of amounts that were owed in respect of the previous financial year, an additional amount that is coming from the 25-26, which is the 5.5 billion rand. And I think, Chair, the following slides, because I'm conscious of the time, we'll also talk to how the trends are showing. So I'm just going to do this one in particular by on an overall perspective. CEO, please may you go to the next slide. So if we then look at the average payment, and we're looking at 25-26 specifically, we're looking at the average spend, which is basically billed based on what was billed versus what was then serviced in respect of the year. We see that the Eastern Cape basically would be sitting at an average of 50%, Free State at 63%, Gauteng 43%, and 34%. And just to say, Chair, our observation from when we look at the trends is speaking to the fact that with regards to these particular two provinces, which really contribute the most amount in terms of our billing, is because of the fact that when they carry the debt in respect of the previous year, the servicing of the current year is then somewhat compromised in respect of the payment of the debt. Then we've got Limpopo, Mpumalanga, and the Western Cape, Chair, which are currently sitting on current, so there are no issues in respect of the servicing of the debt for these particular provinces. Northwest is at 69%, and then Northern Cape is sitting at 69%. Thank you. Next slide, see you. So this, Chair, is then the age analysis, and the CEO spoke to the fact that it basically then would impact in terms of what is the performance from the debtors' days perspective. So we have 79% sitting under 90 days. And just to say that in respect of KZN, it also currently carry the historic debt, which is 2.1 billion rand, which is something that between ourselves and the provinces, we've been working at finding a perfect compromise around how do we resolve this particular issue. But just to say that if we then look at the performance of the provinces where we've seen that there are challenges, the Eastern Cape sits at 338 days with a balance owed of just under 1.2 billion. Free State is sitting at 200 days with a balance owed of 331 days. Gauteng sits at 366 days with a balance owed of under 3.2 3.3 billion. KZN is sitting at 4.8 billion, and that is obviously then because of the 2.1 as well, at a debtors days of 592. Limpopo is at 38 days. Mpumalanga is at 30 days. So then we look at Northwest, which is currently sitting at 294, and then Northern Cape is sitting at 770 days with a balance owed of 523. The Western Cape has got the least amount of days, at 22 days, and a balance of 58.4 million rand. So the total amount that is currently owed or was owed to the NHLS as at the end of March 2026 was just under 11 billion rand, Chair. Next slide, CEO. Thank you, CEO. So this one is one particular slide that for me is one of the one that I think paints the picture really well, Chair, to speak in respect of these balances that are owed. What does it look like in terms of the spread of the financial years? And I'll probably spend a little bit more time on this one. So what we've seen in respect of the Eastern Cape, Chair, is that unfortunately we've seen a significant, or maybe an increase year on year in respect of what was owed for those financial years. So they would have then serviced a portion of that particular financial year. But then what happens is that there's almost like a knock-on effect where the number year on year has increased. So for example, the balance that we still have in terms of the 1.2 billion, almost 1.2 billion for the Eastern Cape is 1.7 million at the end of 2017, 18 and prior. It increased to 2.3. And then if we look at a year like 23, 24, we've then seen that this number has increased to 139.4 million rand. 24-25, we are still have a balance for 24-25 that's just under 326 million, and then the biggest amount is in relation to the current year, which is the 615. So in respect of Free State, our assessment is that initially, in terms of historically, the province was able to adequately service their debt. As you can see, up until 2022-23, they did not have any balances that are owed in respect of what is owed. And then we then see in 23-24, they had a balance of just under 37 million, which increased to just under 75 million. And then we currently are carrying a balance of 219, which then takes them to the balance of the 331, or rather 331.4 million rand. So the other province, Chair, and speaking to what the CEO indicated, and it's going to be addressed in a later slide, that we then have seen an increase over a period of time is Gauteng. So we currently carry a balance of 48.8 for 17, 18 and prior years. That has increased for 22-21, we're carrying an amount just that is 552 million. There's a slightly reduction in respect of 22-23, and then for 22, and then for 23-24 we have 7.2, and then 24-25 is 624. So from my observation, Chair, I would anticipate that the value that we're carrying for 21-22 is probably in respect of an item that was discussed in a recent meeting that we had with the province, where they said that we need to have a discussions about what are we going to do with what is owed in respect of COVID. And I'm assuming that most of this would then be coming from that particular area. So this then says, in respect of the 3.3 billion that is owed by the province, the majority of the amount will be coming from 24-25 and 25-26. Then, Chair, if we look at KZN, the balance that is talking to the historic debt is currently sitting within this category, which is the 17-18. And then if we look at the performance of the province, they actually did very well in terms of the next financial years. Yes, there is a balance that is owed for 21-22 and 22-23, and even a smaller amount for 23-24. So if we look at it, the majority of what is owed is sitting in the historic debt, but also in relation to 24-25. So our observation here is that there was a large servicing of the debt for 24-25, and then the detriment of the 25-26 amount, which then took them to the 4.8 billion. So Limpopo, as I indicated, is currently sitting under current at 81 million rand. So I'm not going to talk to that, Chair. And then Mpumalanga also is showing a good performance. Just to explain, Chair, that if you look at this particular trend, you'll see there are balances that were paid in respect of the provinces by the National Department of Health. And there's still been discussions around how do we then take these balances to basically offset either what is owed or what is going to be coming through as billing in the future. So that is why we see the negative amounts in respect of that. But in terms of what we've billed to them, they currently carry a balance of 76.8, just under 76.8 million. So Northwest as well initially started really well. They started to then have issues in 21-22, which increased, which went from almost 10 million rand. Then there was a reduction to 7.3 and 1.5 in 23-24, and then they still then carry a significant amount owed for 24-25, and the majority of what they owe currently is in respect of 25-26. Northern Cape, Chair, just like the other provinces where we've noticed that they have challenges around servicing of the debt, has basically also had a staggered increase as you look at it. I mean, sorry, not staggered increase, but an increase if you look at it. So the balance owed for 17-18 prior is 18 million, and we look at 23-24, they owe 105 million, and they too also focused on the servicing of the current year, and then there wasn't necessarily adequate servicing in respect of 24-25, and then that took them to the balance that is owed, which is the 524 million. Western Cape, just like the other two that I mentioned earlier, is currently sitting with balances that are owed in the current financial year only. CEO, please may you move to the next slide. So, Chair, I think we wanted to, obviously, in this meeting, acknowledge the provinces where we've seen that really there has been a satisfactory servicing of the debt, which is Limpopo, Mpumalanga, and the Western Cape. So you'll see there that they were billed 81 million, 67.7 million, 58.4 million. And sorry, that's the balance that is outstanding. So they were billed the 825.6 million, just under 847 million for Mpumalanga, and just over $1 billion for the Western Cape. And then this would then have been paying the amount that was owed for the previous financial year, plus the value that we would have billed them, maybe perhaps minus what was then billed for them for the period of March. Next slide, CEO. And then, Chair, what we've included here is just really the top three in terms of what are the balances that are owed. So the balance that is owed by Gauteng region is sitting at 3.3, as I indicated. In the current year, we had built just 3.3 as well, or just under 3.3 billion, and the total paid was just under 1.9 billion. And then the payment towards the billing of the 3.2 was 43%, which then is the 1.4 billion. And then at the same information in respect of KZN, we billed them just under 3 billion. They paid 2.5 billion, and then they paid a small amount in respect of the servicing of the current year debt at 34%. The majority would then have been servicing the historic amount. The Eastern Cape was billed 1.3 billion, and they paid an amount of 1.4, and then 50% was then serviced in terms of what we had billed to them. Thank you, CEO. Next slide. So I think, Chair, this is the slides that I will try to save time, but are really quite important because they then speak to what has been happening. So if we look at the trends, we see that in respect of KZN, there has been an increase of 10% year on year. And just to indicate that we've had ongoing discussions in respect of KZN, especially with making sure that we address the issues around the historic debt. So just to that, I'm sure that the province will cover it, in that they have submitted a proposal with two scenarios around how do we address this issue, and we will then take it through our structures, which is the board and FinCom, for consideration in terms of a solution around the servicing of that particular element of the amount. Thank you, Chair. Next slide, CEO. Thank you. So in respect of Gauteng, Chair, and just to say that from our side, we appreciate the multiple engagements that we've had with the province, and we had one that was recent that was really speaking to a solution, which we are then expecting to receive correspondence in writing in respect of it. Just to say that this one obviously is a cause for concern because it's a 73% increase. If you look at the amount, sorry, I see the CEO. Sorry, see, I think you moved from it, just so that people can see. So we are worried about it. Worried from the percentage growth, but also worried from the rand quantum because of the amount that is built within the provinces, because they are basically the larger component in terms of what we bill. But we are in continuous engagements, and we are looking to seeing materializing in terms of the commitments that have been made by the province. Thank you. CEO, next one. With regards to the Eastern Cape, though we have indicated it to be one of our top three, there has then been a reduction of 13% year on year in terms of the amount that was owed in March 2025 and the one that was owed in March 2026. However, we are then concerned from a perspective of looking at the amount that is owed in terms of proportion of the balances that are billed. And there has been engagements with the provinces, and we're basically awaiting what I would deem would be the outcomes of those engagements in respect of what is going to be the solution for that. Thank you, CEO. Next one. So the Northern Cape, Chair, I think for me, for the Northern Cape, we had a meeting with the province, and we've actually been keeping constant engagements between ourselves, and they've indicated what their challenges are. So we do know that there's an intention around the province to really find a solution, but they've basically sit with a lot of constraints, which I'm sure they'll speak to in their slide. But we will then continue to engage with the provinces so that we are able to find a solution around the 10% increase that we are seeing for March 2026. Next slide, CA. For the Northwest, Chair, so in respect of the provinces as well, again, we've had engagements, and we appreciate the commitment on the province in terms of the servicing of the debt. We are concerned, obviously, about the 64% increase in respect of what is owed. But again, the Northwest has also submitted a formal request in writing to the NHLS, which will be considered around how do we address this issue. And we then also hope that the province is able to honor the terms of that contract once it is acceptable by the board. Thank you, Chair. Thank you, CEO. Next slide. So Free State, year on year, we've then seen a reduction in respect of this province. And I think on this one, we still need to, I think the level of engagement for the Free State is maybe not to the same extent as the other provinces. It's one of the areas that we probably need to go into it, but just to indicate that they've serviced 63% of what was owed and what was billed in the current year. So we then also want to continue to engage with the province so that there's adequate servicing. Next slide, see. Okay, so the next one is then Limpopo, who does show an increase, Chair, but in respect of Limpopo, and you'll see for the remainder of the provinces, we're not concerned because they've basically managed to adequately service their debt. So we are satisfied with the performance in respect of the province. Mpumalanga, the same, they have a 13% increase. However, we are also satisfied with this, with the servicing of the debt. And then the last one is the Western Cape, which we also don't currently have any issues, and we're also satisfied with the servicing of the debt. Thanks, you. I think that is me.
Thanks, Sefo. Chair, I do want to apologize. I am not sure how these three lines came up, and I'm very sorry, and I don't know how to take them out. I imagine they are quite disturbing, but my sincere apologies. So just looking at the last slides, before we hand back to you, Honorable Chair, obviously the key concerns that we have is that with this inability to pay the debt, it then is putting us into a situation where we might not be able to realize the vision of the NHLS as a center of excellence in providing, a diagnostic pathology, teaching and training, as well as research, for South Africa. And which therefore would mean we might not be able to, to meet our mandate. There will be, unable to adequately fund the operations, of the entity, which would obviously talk to essential, replacement of equipment. We know that we are operating, with old equipment that needs to be revamped and replaced. And also, if this continues, unattended, we are looking at an unsustainable revenue model, and we might really not be able to deliver what is expected of us. And this poses a big threat as to whether then we might find ourselves, as a going concern if our liabilities exceed our assets. So, Chair, we thought we'll just include in this slide that in the midst of all of this, I was talking earlier on about the grants, the grant that we get from the National Department of Health. And just to highlight that, I mean, the grant that we receive, it does not adequately cover, all the expenses, the expenditure that we incur from these institutes, as well as FCL teaching and training. And you can see that there's a variance that the NHLS covers. So over and above, the work that we do, we also are supporting and ensuring that the functions of NICD, NIOH, forensic chemistry labs, teaching and training and research continues to happen. And so really what we are looking at, the first one would be, could we come to a point, Honorable Chair, where the laboratory services funds are ring-fenced as an essential service, so that when the monies get to the provinces, we have got the confidence that, whatever is budgeted for pathology services, it will be kept at that, and it then can come through to NHLS. And the other thing that we continue to do, and as we engage with provinces, because we do see a lot of wastage where there are frequent requests of laboratory tests, and we then have talked about the electronic gatekeeping, and we need to make sure that the electronic gatekeeping is managed effectively, because even though we do have EGK, you find that it is not well managed, and the management thereof unfortunately has got to come from the provinces, because it comes from the clinician side. And really our ask is that whilst we are talking about historical debt, for us, it becomes important to make sure that the current debt is serviced, timeously. And we've been saying to the provinces as well, they mustn't forget that if they pay their debt on time, there is also an incentive, a small percentage, a discount that is given if, provinces could actually pay their debt on time. So around the historic debt, we, as already highlighted, we are in discussion with the KZN Department of Health on how we can resolve the debt, the historic debt, and we're also going to be engaging with the provinces as they are sharing their plans, how they can finalize possible settlement agreements around the historic debt. And so really, for us, it is to end, if we can we not make a request or motivate for National Treasury to ring fence the provincial laboratory funding, whether it goes to the provinces as ring fenced, or could it actually be transferred directly to the NHLS? And I think for us, these are some of the discussions that we would want to engage, and we appreciate the fact that the portfolio committee has brought this, and it just highlights how critical the historic and non-payment of debt is, and we truly appreciate, and we're hoping that from these discussions we will begin to see a significant improvement wherein debts will be serviced as appropriate as is possible. Thank you, Chair.
Thank you, CEO. We will at some point have to cut and get questions and do question and answer, so that we don't cloud members with a lot of presentations. I'll then hand over to MEC Gauteng Health. Over to you, MEC Mazibuko.
Thank you very much, Chair. We have HOD online and the team from the CFO. They will share our presentation with yourselves. Over to yourself, HOD.
Thank you very much, MEC, and good afternoon, Honorable Chair. Good afternoon to all the honorable members. Can I ask that the presentation be flighted? Perhaps also the office of the HOD, Wayland and the team to flight the presentation. Chairperson, whilst the presentation is being flighted, I can just say, Chair, that as a Gauteng province, we have acknowledged the the challenges that the NHLS have faced. And we've also acknowledged some of the challenges that we had in the past with the payment of our account. And this meeting comes against the backdrop of a discussion that we had with the NHLS and some proposals that we have put forward to the NHLS. Can I check, colleagues, can we please load the presentation so that the members can follow the presentation as I'm presenting?
Actually, I'm not sure if Wayland and
Yes.
colleagues are struggling. I could try and load it from my side if you permit.
As you are doing that counting, there are people with gadgets like 146888956. Can they rename them? Can they rename them?
Adil, you can load the presentation if possible. I'm sure the Secretariat will provide you with some rights to do so. Thank you very much, Chairperson. So, Chairperson, on the next slide, we're just sharing with you the key outline of our presentation and what we aim to present to you. I think the first parts just deal with the background and context, also with some of the expenditure trend analysis and some of the historic accruals. And then we'll go into what we have proposed to the NHLS. Of course, we know, Chair, that it is still subject to engagements in the formal structures. But as a department, we have gone back, we have cleaned our house, and we are now ready to ensure that we can also contribute to the sustainability of the NHLS. On the next slide, Chair, on slide 3, we're just sharing the purpose of the engagement, the debt exposure that we have, the payments that we have made, the outstanding obligations, and also what are the turnaround times that we are putting forward to deal with the historic debt, but then also deal with the current debt. And on the next slide, Chair, we noticed that due to the growing financial challenges and including the operational challenges, it was important for the department to relook at the manner in which business is conducted, but also the sustained clinical demand, the increase in migration into Gauteng have played a significant part in the manner in which we conduct business, but then also the significant shortfalls that we have. But this also means there are broader system considerations that's outside this process that needs to be considered. But despite all of those challenges, Jay, we have now come forward with a proper plan of action. Let's go to slide 5, colleagues. On slide 5, Jay, what we are saying is that we need to ensure the management of clinicians. I think the CEO was quite clear on that, and the CFO. We also need to deal with the frequent requests because the system cannot pick up if there's a request today and if there's a request the following day. And then also as the department, we have strengthened our internal controls to ensure that we can maintain the current account. Chair, one thing that has been a significant challenge for us, and that's why we are starting to forge a much more integrated partnership with the NHLS, is the weak end-to-end verification chain. And what does that mean? If there's weak end-to-end verification, it means you will obviously land up in this huge debt that you need to face, and then also the huge debt that you need to pay, which you won't always have the funds for that. But we are also saying as a department, going forward, we're going to ring-fence a portion of the funding for NHLS, but we will implement stricter controls in our facilities. The challenge is fundamentally not necessarily a debt issue alone, but it also goes back to the governance issues, the laboratory financing, and then, as we most importantly say, is the end-to-end verification, but then also a structured reconciliation and a system strengthening. On the next slide, Chair, specifically slide 7 and 8, we're just showing you the demand for services and the sustained increase that you have over the years. And that is the demand for health services in Gauteng. And we have mirrored that with the amount of immigration into Gauteng, and specifically those neighboring provinces that comes to Gauteng for health services. And on the next slide, we're just showing a steady increase in the accruals that we have not been able to service over the 8-year period. But now that we have done a proper reconciliation, we are now at a stage where we can put forward these proposals. Chair, on slide 9, we're not saying that we have not paid the NHLS. We have said that this is a demonstration that we have paid. We have not been able to service the debt at the level that the NHLS have required, but I thought it was important that we show that. I think, Chair, we can now go on to the proposals without belaboring the points in the meeting. And on the proposals, as at the end of April, Chair, I think the previous slide, please. As at the end of April, Chair, we're saying we have been billed and our current statement showed an amount of 3.5 billion. When we received that, the amount of 246 million that was paid in May was not reflected. So it means you're sitting with a balance of about 3.3 billion. Chair, in that 3.3 billion, we have COVID-19 invoices amounting to 693 million. And then, of course, it gives you about 2.6 billion outstanding. Currently, that we have verified, Chair, that's in the system, and as soon as we have finalized our payments, there should be an amount that is ready for payment that's about 1.3 billion. But the amount that's in red, Chair, this is the amount that we have reconciling differences between the supplier statements, but then also the books of the Gauteng Department of Health. And as we want to avoid this amount increasing and increasing, it's for that reason that we have now felt that we need to establish a partnership where we can have an integrated team, both from the NHLS and from the Department of Health. And we'll also bring our 4 central hospitals on board that is contributing for the biggest amount of outstanding debt. And what we are proposing, Chair, is a formal proposal is on its way. We had the discussions with the NHLS, and this is what we are putting forward to them. Chair, so on the next slide, we are putting forward, and we wanted to propose to the NHLS that the amount that is due in relation to COVID-19 invoices, that's still subject to verification by the NHLS themselves. At about 693 million. We want to propose that that amount be written off, Chair, and we then say the outstanding amount of 2.6 billion, we want to pay that in equal installments that will amount to 876 million per annum. And that will be in monthly installments of about 87 million. And that is on slide 11. Please, Adil, to the next slide. So it means 876 million will be paid per annum, and that is only on the historical debt, Chair. That's historical debt, which means with effect from the 1st of June, we will pay that amount, but we will also service the current debt, which means whilst we are paying the historic debt, we don't want to incur any current debt. So all the current debt will then be settled. But to ensure that we all have the same trajectory going forward, Chair, we say that between the NHLS and us, we need to establish a partnership where the teams need to meet on a monthly basis. Firstly, when the statements are made so that it can be properly reconciled against the evidence that we have as a department, and then we can ensure that payments are then made within 30 days. And that governance system will be able to strengthen internal control. It will also be strengthening the work that we are doing with the clinicians and the internal controls that we are putting in the hospitals as well. Let's go to the next slide, please, colleagues. And then, Chair, there is plans for a more longer term approach where we're looking at automation of the reconciliation process, but then also more broadly looking at your digital laboratory order entry that is linked to the patient identifiers. But in the short term, Chair, we are saying that we will settle the outstanding debt in this particular order. and we will sort out the current account, and the multidisciplinary team that will be established will deal with all the disputes that we have, the 1.9 billion, so that that can also form part of the payment plan, Chair. Chair, on that note, I can say that would be the proposal for Gauteng. And as we had the engagement with the NHLS, they did indicate that it needs to go through the formal processes. And Chair, I'm going to ask if, with your indulgence, that we stop there and give you that as the proposal from Gauteng. Thank you very much, Chair.
Precisely what we wanted to hear, HOD, as long as you stick to your commitment. But members are going to engage on that one. Let's first take KZN members. Then we'll then have to discuss the brief by the NHLS, then Gauteng and KwaZulu-Natal. KZN MEC, can you introduce the team and will you take the platform?
Good afternoon, Chair. Good afternoon to all the members. Thank you so much for having us. Chairperson, I am with the head of department, Mrs. Msimango. She's the one who is leading the team online. We also have the CFO, who is also part of the meeting. And yes, so Mrs. Msimango is going to take us through, Chair. Chair, I do want to, before handing over to her, indicate that indeed we have been having discussions with NHLS, and there are proposals that we have made, and we appreciate the spirit that NHLS has allowed us an opportunity to engage with them. And we do want to make a commitment, Chair, that we will honor the agreements that we have agreed on. The reason why we have been struggling with our current debt mainly, it's because during the 24-25 financial year, our finances were severely affected as a province because of historical cuts to our budget, our baseline. However, in the past financial year, we have been making payments, Chair. Our biggest challenge also is the historical debt, and that's where we have made proposals to NHLS on how else we can address that debt, but we are willing to address it. Can I then hand over to Mrs. Msimango, Chair? Thank you very much. Thank you very much, MEC.
Let's resolve the gadget and the echo, HOD.
Thank you very much, MEC. Maybe, Chair, Honorable Chair, if I can be afforded the sharing rights.
You do have the sharing rights.
Okay. It's saying it's disabled. To share from here. It's saying it's disabled, Chair.
Are we resolving that, Secretariat? Or you can fly
Or
it.
maybe she can share on my behalf the presentation that we sent.
There we go. It's coming.
Yeah, thank you very much, Chair. I can see the presentation. If we can go to the first slide. We're starting with indicating the purpose of this presentation, that it is to present the status of our NHLS debt as KZN Department of Health and the interventions that have been implemented and are proposed to deal particularly with the historical debt. Over the years, there have been a number of attempts to do reconciliation so that we are able to align the financial records in terms of the historical debt. There has been progress that has been made, but there are a few discrepancies that remain unresolved. Next slide. We have a total outstanding debt for NHLS of 3,940,424 as of 12 May 2026. This debt is made up of a historical debt of 2,574,353 and a current debt of the period between July 2025 up to March 2026 of 1,366,000. We also want the members of the portfolio committee to note that we have been continuing to make payments to the value of 3,431,000 that we have paid for the period between April 2025 and 13 May 2026. We are doing everything and all efforts to pay to all invoices that are received. However, the department is faced with severe cash flow challenges, which are affecting our payments to suppliers generally and service providers. So as a result of all the efforts that we have been making in order to deal with the historical debt, we started discussions and negotiations with the NHLS management, which premised from the fact that after the KwaZulu-Natal Provincial Laboratory Services were integrated into NHLS, NHLS started occupying the buildings that are owned by the Department of Health. So in those engagements, we agreed that NHLS from now on will pay rental for the property used within the Department of Health facilities to compensate for the utilization of those facilities. And the parties will also agree, the parties also agreed on the appropriate rental rate and utilities. And we are also going to agree on a joint verification process. We agreed on that. And after that, we did an audit of all the facilities that are occupied, including the assessment of the square meterage that is occupied by NHLS. Next slide. After that, then we discussed how the fair rental value is going to be determined for the period of occupation using applicable market-related rates. We looked at prevailing market-related commercial property rates and independent property valuation methods were used. So these valuations per square meter were informed by the location of the facility, whether it's in the rural area or urban area, the condition of the building, the nature of the improvements that NHLS might have made, the utilities and operational suitability of the laboratory services, comparable market rentals, cost incurred by the department in securing, maintaining, and keeping up the relevant properties. Next slide. At the same time, we did not want to treat NHLS as a private entity because we were quite aware and we acknowledge that NHLS is a self-sustaining public entity under Schedule 3A of the PFMA and is not a privately owned commercial enterprise. So in this regard, our discussions and negotiations focused on balancing market-related principles with intergovernmental cooperation considerations. So following these discussions, we then agreed on 100 rand per square meter for permanent structures and 20 rands per square meter for temporary structures being park homes, where NHLS is occupying park homes owned by Department of Health. So this rate will be used across all these types of buildings occupied by NHLS. And also there was an agreement that despite the historical debt, NHLS is going to start reimbursing Department of Health for rental as from the 1st of April 2026. Apologies. Next slide. I've mentioned the issue of how the historical debt was calculated, and the period of occupation agreed commencement date was 31st March 2026. Also, in the previous slide, I wanted to mention that the period from which we wanted to calculate the historical debt was from 2006 up to 2026, 10 years back. So I just wanted to clarify that. Also, we've agreed that this will be effective from 1st of April 22, which means every month now, NHLS will be paying rental to the Department of Health. So the amount of the historical debt owed by NHLS was agreed upon at a value of 803 million. But this exclude other rental services like parking and utilities, of which we are still going to sit down with NHLS and discuss those, because also this will also depend on the size and the type of building and so on, and the consumption rates for both for utilities, whether it's electricity, water, and so on, or the number of parking bays that are being used. Next slide. Also, to ensure finality and strengthen institutional cooperation, the department has agreed that, proposed that we follow a reconciliation process which will ensure joint financial reconciliation and final verification and sign off reconciled amount by both teams, because this is still a proposal that we are putting forth. So once it's done, we will do a final reconciliation, and then the two parties will sign off on the amounts. And then following that, following the legal processes, we are going to enter into a formal settlement agreement between the Department of Health and NHLS, which will outline the total agreed rental amount, the treatment of the previous amounts, settlement terms and timelines, governance and reporting obligations. Next slide. So in actual rands and cents, the total debt owed for rental by NHLS to KZN Department of Health is 800,762,160, and we are proposing that this be used as a full and final settlement for the NHLS historical debt. And we then enter into an agreement with this once it has been approved by the board. In addition to this, NHLS has been looking for a building in KZN to accommodate their forensic chemistry laboratory services, which we have offered to assist as KZN Department of Health, working with Department of Public Works to offer this building for them to accommodate forensic chemistry laboratory services, in addition to the 800 million settlement, so that this is treated as our proposal in order for us to settle the historical debt. And then current debt, we will continue to service the current debt, as we have been saying, as it is shown in the earlier slides, that just in the 25-26 financial year, we managed to pay about 3.4 billion to NHLS. Next slide. So here we're just citing the governance and compliance legal prescripts that will guide the settlement agreement that we will enter into with NHLS. We do want to emphasize that the intention of this proposal is not just to ensure financial recovery on both sides of NHLS and KZN Department of Health,
but we want to ensure that there is formal regularization of this long outstanding matter and ensure that there is sustainability both in NHLS and KZN and transparency as well as strengthened intergovernmental relations. We also want to emphasize that the historic debt finalization will be undertaken in a structured manner that will enhance financial certainty, improve audit outcomes, retain the integrity of amounts disclosed in the audited annual financial statement, strengthen governance and governance compliance, and reinforce collaboration between the two parties. Thank you. As a conclusion, we just also want to ensure there was a question that was asking whether there have been any service delivery disruption as a result of the non-payment of the debt. We just want to assure the honorable members that there has been no service delivery delays because of the historical debt. NHLS continues to provide a full service to the Department of Health despite the debt that we owe. However, the ongoing budget cuts have been limiting the department's ability to pay the historical and the current debt. In conclusion, we are requesting that the Portfolio Committee notes the presentation of the KZN Department of Health on the NHLS debt and the proposed recommendations for settling the historical debt. Thank you. Thank you, Chair.
Thank you so much, HOD. I think it's time now I allow members to raise questions on the presentation by the NHLS, Gauteng Provincial Department of Health, and KZN Provincial Department of Health. Can I see a show of hands, colleagues? I'm noting Honorable Mutubatse, followed by Honorable Clark, followed by Honorable Leroux, followed by Honorable Shirampungose, followed by Honorable Sine, followed by Honorable Kumalo. Yes, those are the hands I can see now. Honorable Mutobatse, can you start?
No, thanks very much, Chair, for the opportunity, and thanks for the presentations. Chair, allow me, because just on KZN, I have close to about 40 questions. I'll just ask 3 questions. And then I'll forward the others in a written form. I just want to, because there are some, just as an opening, because my concern is that the legality of the contract or the attempt to settle the account. What is the legality? On what legal basis the department entering into this agreement? And why was the rental not invoiced annually from 2006? And I think has the National Treasury approved the proposed settlement model? And also, has the Office of the Auditor General been consulted to determine whether the retrospective rental invoicing constitutes irregular accounting treatment? And that is on KZN. Yeah, I think let me leave it there, Chairperson. The others, I think, on Gauteng and national, I will forward written questions. Thanks.
That's in order. Honorable Clark, over to you.
Thank you, Chairperson. Thank you for the presentation and thank you to all the provinces for being here. And I would like to thank you, Chair, for calling this meeting because this is a very important meeting and allowing us to consult with the provinces and the problems we're facing. So just on the NHLS, I want to ask, what is the realistic sustainability of the NHLS if you do not get the debt serviced? And regarding the aging infrastructure, how long before the equipment becomes obsolete and how often is the equipment maintained and new equipment bought? And when was the last time equipment was bought? And what is the explanation for the requested tariff increases not being granted? Then I'm going to go over to KZN. So the rest of them, I've got a lot of questions, Chair, but I'll also submit them in writing in order to get through the meeting as well. KZN, how are you planning to pay off this debt and how are you addressing the financial management in your province? Explain your cash flow problem, how long this has been going on for, and how are you addressing this problem? And why do you expect service rendered to go unpaid? What other services are you failing to pay? And do you have debtors that have put you in similar financial predicaments as you continue to do to the NHLS, and what do you do to them? Then in terms of Gauteng, how have you allowed your debt to increase by 1.38 billion rand? It's about a 73% increase. How are you planning to pay off this debt and how are you addressing the financial management in your province? What was the response to the concerns you raised regarding historical billing, verification, attribution? And why in 8 years have you not managed to improve expenditure predictability, utilization, demand management, or long-term sustainability? And one just wonders how much of your debt would have been settled if you had not allowed corruption to hollow out your province, because in Gauteng we have a huge problem with corruption there. And why do you expect services rendered if they go unpaid? Chairperson, the rest I'm going to submit in writing to you because, as I say, I've also got a lot of questions, and if that would suffice with your permission. Thank you, Chair.
Thank you so much, Honorable Clark. Honorable Leroux, over to you.
Thank you very much, Chair, and thank you for the presentation on the NHLS and from the Gauteng and the KwaZulu-Natal Departments of Health. I think that the first question that I have is around the just to the NHLS in terms of the evaluation of the 11 billion rands. How much of that do they think is fully recoverable? I know it might be a difficult thing to answer, but I see already Gauteng has proposed that some of, I think the figure was nearly 800 billion gets written off, and so I would like to get a sense of that 11 billion, what do they think is recoverable? And it might be that the provinces don't agree, but that's the first question. I think that the second question is, I mean, the Gauteng has now put a settlement plan together, but is this spent basically over 3 years, and the question is whether that is a plan that would help the NHLS work things out, or is that too slow? Is that adequate? Is that something that has been just discussed together, and will that solve many of the problems that they've got in terms of the NHLS issues? Then my question for the provinces is just around I think the issues of administration and management. From what I understand, for example, Gauteng seem to have had some agreement and discussion in the previous dispensation before the 24 election, and with a new administration coming in, a new MEC, some of these agreements seem to have kind of fallen through the cracks. And so I think it's obviously important if we make these agreements that they continue to be implemented. And so I just want to understand the process. Why did that happen, and how can we prevent that from happening again? Then just to both provinces, and I think this is something I'd like to ask all the provinces in terms of ring fencing. I think that's something that the NHLS has asked for. Is this something that is within the budgeting capacity of the provinces to do, and how would one do that if so? And then I think that I think all my other questions have actually been covered. So thank you for that.
Thank you, Honorable Niru. Honorable Shirompungosa, over to you.
Greetings to yourself once again, to all the members, the department, the NHLS, and the provinces that are with us namhlanje. I think I was a bit thrown off with the last assertion by NHLS that they are regardless able to deliver the service regardless of the current situation with debt not being paid. I'm not certain what that assertion was said to drive to, because NHLS has been struggling. And part of the reasons that they said they were struggling was because they have unpaid debt. So that assertion that you said at the end is actually quite dangerous and actually just takes us back. Then it means it's not the provinces, then it means the problem is you as an entity. So I want to find out from NHLS which provinces are paying for private healthcare contractors and consultants, noting that they are refusing to settle NHLS invoices. I think that linkage will be very important, because fundamentally we have provinces that prioritize the private sector over the public sector, despite the fact that they are serving in the public sector. They don't miss their private contracts. They pay on time to the private service providers. But when it comes to nourishing and enriching the public sector, then they are found wanting, like what we see right now with KZN and Gauteng. And secondly, to NHLS, we want to find out how much of the debt crisis is linked to corruption, to accruals, to medical legal claims, and outsourced healthcare contracts. I think if they'll be able to make that particular link, it will assist also in how we engage with other provinces, and particularly KZN and Gauteng. And KZN has the largest debt in accordance to what the presentation was about from the NHLS, right? With historical debt dating back to as far back as 2008. We want to find out from the KZN Department of Health, how did you allow this to happen? How did you allow to having a dispute dating back more than a decade to remain unresolved whilst the communities are facing collapsing hospitals? Number two, how many TB, HIV, cervical cancer, and oncology patients are experiencing delayed diagnosis because the NHLS services are financially constrained? And number three, how do you justify as a department spending on private security, private consultants? You even get private contractors for the most menial of jobs, just organizing travel. These are functions that you can do as a department, but you choose to outsource them because you want the money to go to the private sector. And you've got high medical legal claims, settlements. You settle all of these things, but you struggle to pay NHLS. Please just take us through your prioritization of how you prioritize debt systemically in KZN, because the NHLS is linked to primary functions of the Department of Health, and you're overseeing that whole system in the province, but it's not a priority for you guys. Yeah, what is more of a priority is paying the agency that will organize my meetings, that will organize you guys traveling to very ludicrous meetings and gatherings, if I may, Chairperson. Apologies for that. But you are failing to prioritize the NHLS, and we want to find out from you as a department, what do you think the impact of this debt is on rural hospitals, such as those Mkanyagute, Zululand, and eThekwini, where laboratory turnaround times are already poor. What do you think this does to yourselves as a province and ensuring that people have access to NHLS and their services? And some of these crises that are sufficing in your hospitals, like with Eddington, RK Khan Hospital, with overcrowding, oncology backlog scandals in KZN over the years, the HIV and TB burden in rural districts. How have you failed to make the link to the fact that you are failing a primary sector of ensuring that services in relation to the NHLS are given to the hospitals and the people in your province? It really gives me a great concern, Chairperson, and I think we must not let them off the hook. They must really just come back to us right now and make a commitment in Parliament so that we can hold them accountable to that. Give us dates and times on how you're going to work around this. You've known about this gathering, you've known about this meeting, you've known that you've been poor, you've been the worst performing province in paying debt to the NHLS. So give us dates and times of when what you're planning to do and how you're going to do that. And in relation to Gauteng, another catastrophic situation. Gauteng is the richest province in South Africa, but Limpopo is doing better than Gauteng. Mpumalanga is doing better than Gauteng, despite the fact that they don't have the same budgetary confinements and limitations. Gauteng is in a better position. And the fact that Western Cape is doing better than you guys is proof of that, right? What effect has this debt in your province had on major academic hospitals like Chris Hani Baragwanath, Charlotte Maxeke, and Steve Biko? And how many pathology delays affected cancer treatment, maternal health care, and trauma services? These are specific questions. They need numerical order and numerical answers. Chairperson, I think it's important that we start linking these failures to actual lives, because it feels like we're just speaking at a very broad level. It's vague, it's broad, it's on top. But we're talking about real life situations. We're talking about people's lives, people's results being delayed, and how that impacts, even the spread of illnesses and viruses. And the provincial departments must start seeing what that looks like on the ground, the damage that they are doing. If Mpumalanga can do it, if Limpopo can do it, if Western Cape can do it, you definitely can do it, because you're already spending a lot of money on corruption. We did an oversight visit over the years, even in the NCOP. The stuff that is happening in the Gauteng Health Department is absolutely deplorable. You have fake hospitals in Gauteng. You have inflated prices for security services. Gauteng is the worst, really, when we're speaking about this particular debt. And they really must just give us tangible answers as well. Bona KZN, they must not get off the hook. Namhlanje, we want tangible answers. Give us answers, dates and times, and how you're planning to ensure that this system that is going to be taking place from today onwards is going to be sustainable. We can't take an excuse from Gauteng. You cannot come and tell the NHLS that you cannot be able to service the debt. That is something we will not be able to accept. It's unacceptable. Pick up your socks. If you're unable to lead, please vacate office. Thank you, Chairperson.
Thank you, Honorable Chiram Pongose. Honorable Sine, over to you.
Thank you, Chairperson. Chairperson, actually, my first question is for Gauteng, and is what Honorable Shira was talking about in terms of the report from NHLS that Gauteng indicated it cannot service the debt. I want to hear from Gauteng their official position. When they respond, Chair, can we hear them saying that to members of Parliament of this portfolio committee? And on KZN, Chairperson, I think we must just call out KZN as the primary fiscal threat to the NHLS, Chairperson, because their report is very, very bad. So I want to know how the province is ensuring that the current laboratory services do not continue to generate new areas while the historic dispute remains unresolved. And Chair, on the payment plans for actually this it's going to be for all provinces. Can we have clear, concrete, time-bound payment plan to their current outstandings, and how they will guarantee that future invoices in the second half of the financial year will be paid within the 30 days period? Thank you, Chair. I'm actually covered by the previous honorable members, but I think clear plans with timelines is what we need out of this meeting. Thanks, Chair.
Thank you so much, Honorable Sine. Honorable Kumalu, over to you.
Thank you very much, Chairperson. Am I audible, Chair?
Yes, you are.
Thank you very much, Chairperson. Thank you for the presentation from these two provinces. I'm just having questions, Chairperson, to Gauteng. I want just to check, Chairperson, when Gauteng is saying that NHLS must write off its debts, what do they mean? And how are they expecting that NHLS should survive? Because it survives on these monies that provinces must pay. Does their statement mean that the services that NHLS rendered to them would have been free? And then also, Chairperson, I want also to check here whether the Auditor General, does it raise the findings relating to accruals, unpaid invoices, or financial controls connected to NHLS debt? What consequence management actions have been implemented? What oversight role did the provincial treasurer play while the debt is increasing? To Gauteng, I mean to KZN Chair, I want just to check, Chairperson, what controls have been introduced to prevent further unpaid accruals? Also, Chair, I want also to check to the department, has the department requested financial assistance from provincial treasurer or national treasurer? And what were the main causes of the accumulation of NHLS debt in KwaZulu-Natal? Why was the department continued accumulating debt despite the repeated warnings from NHLS and oversight bodies? I think, Chairperson, those were my questions. And also, Chair, when you were checking the stakeholders that are part of the meeting, I didn't hear the presence of Western Cape. I don't know whether it has just jumped me or they are not in the meeting or they are in the meeting. Thank you, Chair.
Let's cross that bridge of the Western Cape when you come to it. Let's then allow Dr. Litlape. Is going to be followed by Honorable Mjadu, then Honorable Marie, in that order.
Thank you, Chair. I'm not in a place where video will be appropriate. I'm at the airport and I hope the noise levels will be low. My first question is about, the debt swap structure and the issue of rentals in terms of, does the rental go to Public Works? Does it go to the department? Who is the landlord? And secondly, those agreements, are they evergreen agreements, or are you signing a lease period where after some period you'll be out of a lease? I'm just concerned if the department doesn't maintain the buildings and you need to have your own place where you put new equipment. How do you get out of that? And how is that gap going to be bridged going forward? Because if you move out, there'd be loss of income for them. And how will they sort out the budget deficits? And Treasury, has Treasury approved this arrangement, and what are the basis of those arrangements? Then to everybody, including those that have not presented yet, in terms of the share allocations to provinces based on population sizes, those of you that are impacted by high numbers of people from outside, have you got the data, the records of what components of the population that you see are people that come from outside, documented or undocumented? And how do you balance the books for the services that you render that would not necessarily be budgeted for by Treasury and by the way we allocate funds? And how do you bridge that gap going forward? Because unless we hear from you, we'd expect that from that aspect, things are hunky-dory. There are no real issues for you. And I think going forward, Chair, we probably need to ensure that the laws of the country are followed. Any HOD that does not do their duty in terms of PMA, in terms of paying current invoices, as per the regulations of the country, should be sent to court for violation of PFMA, so that we can talk about what happens in the history, but we need a future where the HODs understand the importance of paying their bills on time to the NHLS. Thank you, Chair.
Thank you so much, Honorable Dr. Litlape. Honorable Mjado, over to you.
Thank you very much, Chairperson, honorable members. I just want to agree with Honorable Mpungose. She's right. I'm from there. I'm from KZN. I know what is happening in KZN. Everything in KZN is collapsing because of corruption. You can, Chairperson, I think we must invite KZN to come to Parliament. You must go to Ngwelezan and see, and go to Mshien Arkekan. You can see, Chairperson, what I'm talking about. I don't know, Chairperson, who's right here, NHLS or Department of Health in KZN. I think you remember last week I've asked NHLS, I think it was CFO, about the space in KZN. The answer that I received from NHLS, they told this committee that the Department of Health in KZN, they didn't send anything. They've been writing letters to them. Only, I think it was only KZN didn't send anything to NHLS. And then I'm surprised today when the HOD is telling this committee that they were having several meetings with NHLS, because CFO told this committee that KZN is not responding to their call, only KZN. So I just want clarity on that one, and then I'm 100% agree with Honorable Mpungose. Everything is collapsing in KZN because of corruption. I think, Chairperson, let us invite KZN to come to Parliament so that we can dig other questions. We know what is happening in KZN. They are employing their friends, their comrades. They are giving tenders to their comrades and friends. That's what we got some evidence here. When they come here in Cape Town, we can ask them. So, for now, Chairperson, let me end here. I don't want to say much about Gauteng, but one of the doctors put something on, I think it was on social media, social media. A toilet, it's like, it show us where nurses and doctors stay. I think it was nurses' home and the hospitals. When you look at on those pictures, toilets are like you do know rank toilets. They were very dirty, and those photos were circulating all over the social media. Let me end here, Chairperson. Thank you very much.
Thank you so much, Honorable Mujado. Honorable Marie, over to you.
Thank you so much, Chairperson. Chairperson, I also would like to bring it to your attention that I'm also very worried about KZN. We did some oversight in KZN with TSD, and the people were complaining about the conditions of hospitals not being assisted. And seeing that they are owing so much money, Chairperson, is a concern, because how many people are waiting for oncology? How many people are waiting for results that must come back at this urgent, where people's lives basically is lying on a line because they are taking their own time? And then on the story of Gauteng, Chairperson, is concerning, because if you look at the Mpumalanga Commission now, everyone is talking about Gauteng in the hospitals, the tenders that went out, even for skinny jeans and all these things. But still, they cannot service their debt. And it is not new debt, it's old debt. So for all these years now that the debt is outstanding, Gauteng has been undermining the government, and Gauteng has been undermining the Auditor General, because I'm sure the Auditor General outlined the worries that he's having about the hospitals and about what is happening there. And the money that is outstanding is such a lot of money, and so many people can be assisted because of them not paying their debt, Chairperson. So Johannesburg doesn't have an excuse, because they are a business hub. If Western Cape doesn't, that it's only having the sea and the mountain there, and tourists, they can do their things. Why come Johannesburg can't do it in KZN? Because KZN is also a tourist attraction. So, Chairperson, this thing is a huge concern for me, because this is a no-no. Our people are complaining, sleeping on the ground. Our people are saying there's no medication, there's nothing happening. And now we see what is happening for ourselves. And then they want to ask us, can we write off the debt? It can't be like that. A business hub like that is having billions in their fiscus every year, want us to write down billions of rand. It cannot happen, Chairperson. This is unacceptable. Thank you so much, Chairperson.
Thank you so much, Honorable Marie. From my side, these are the issues I want to raise with the NHLS first. Chairperson, I'm looking at the recommendations here. Now you are saying urgently resolve outstanding KZN Department of Health historic debt. NHSL and provincial DHOs finalize possible settlement agreement. And then to me, it's just that it's only happening now because we are saying we have called this meeting. I believe in the NHLS, there is a CFO and the manager revenue. At some point, chairperson of the council and CEO. There's mechanism in government which you need to follow if the other party is not paying you, to an extent that you know how to utilize the cooperative governance mechanism that is in there to resolve dispute in the public service. And I don't see it anywhere in the presentation as to what steps have you taken as an NHLS to make sure that these parties paid and whatever. Because the question also that I'm asking, MEC Mazibuko, there's an allegation that Gauteng has indicated that they cannot service the debt at all. And then with that type of an attitude, what is the what steps have you taken as the NHLS, bearing in mind of the cooperative governance mechanism on resolving disputes in government that I'm raising? Also, this issue now, because at some point, to what extent also is the provincial non-payment increase the outsourcing costs, especially in pathology, toxicology, or other specialized diagnostic services? And then also, because it's not about, because at some point there, as I read the presentation, you might find that the accuracy in your billing is a problem. That's why others don't pay. But to what extent, I want to know from you, how do you differentiate between billed amounts and cash received across provinces? And are there recurring billing or coding disputes? Somebody has raised that. And then the issue now with regard to Gauteng and KZN, to you two MECs. I also believe that there are senior officials, accountable officials, that are responsible for managing these NHLS accounts. And then I just want to understand what corrective actions are you going to take as Gauteng Health, as KZN Health, to implement or to prevent recurrence of unpaid invoices? Those are the commitments that we want to hear from you as the leadership of the two provincial health departments. And there's an issue around consequence management. As long government had adopted the 30-day paying period, as some of the colleagues have raised, and we all know that you are doing it to all other private service providers. And then the issue that comes around that are the steps that you are going to take through your HODs, because we know you are all appeal authorities, to make sure that those accountable senior officials that has been responsible, if they are still within the department, those that has been responsible for managing the NHLS accounts, there are consequence management, because just violation that a government policy of paying within 30 days, it's problematic. I should say that. Or do you also then prioritize paying you pay the others, and then this other one you say, it's by the way, it's a government entity, we're not going to pay, because you have to pay for services that has been rendered? And I also then want to get your commitment, MEC Simelane and MEC Mazibuko, that are you going to commit to report quarterly to us as Parliament on this NHLS payment, and also on the debt reduction and progress against any settlement plans that you have put? So those are the issues that we want you to talk to as you respond. That's how one would like you to. You'll see the division of labor. MEC Mazibuko, you have asked to be released earlier. Maybe let's start with you, then KZN will follow. Then I'm doing that so that NHLS, and when they respond, they will be able to also to respond to some of the issues that these two provinces will have raised. Over to you, MEC Mazibuko and team.
Thank you very much, Chairperson and honorable members, for the questions. We've noted all the comments that have been raised by members, and your comment, Chair, that there are allegations that we said we do not want to pay the accruals. I'm not sure where does it come from, because the team had already met with the CEO and other members from the NHLS, and that agreed on payment schedules. Out of the money that we owe the NHLS, as you can see, we had paid almost 43% of the accruals, and we had committed that this is how we'll. So the CEO, I'm sure, can be able to
bail us out on this one, because it's something that we'll have agreed that we'll do. Of course, some of them are old debts that during COVID, but we did not say because they are old debts from COVID, we're not there, but we're also taking that into consideration and started working on ensuring that we deal with that debt. We understand that it's an institution and it must also account. So it cannot be us that falter when it comes to the payment of debts that we actually have. In fact, don't think, I want to share with members that, you see, they see these billions in health. There's no money there. Almost 61% of it goes towards salaries, which is your compensation of employees. We were left with 39% to be able to service all the debts and the service delivery. We build clinics, we build hospitals, we pay for all other things. There's machines that get broken and all those things, including the National Health Laboratory Services. So it can't be us that do not take seriously our debts. And there's not a lot of money here. There's too much money that we actually have to utilize in order to deal with that. Some of the questions, I'll actually give them to HOD. And in fact, on committing to report quarterly, Chair, we're ready, we're willing. Yours is just to invite us to when is the next meeting, so many a schedule, so that we know when are we reporting back to the committee in relation to the work that we'll have done. Let me also afford HOD to respond to some of the questions. Thank you very much, Chairperson. HOD.
Chairperson, thank you very much. And also let me thank the MEC. Chair, in no way whatsoever did we indicate at any point in time we cannot service the debt. We are willing to do that. And Chair, I can also say that we have not convened a meeting with the NHLS on Tuesday because in anticipation of this meeting. Actually, we had a meeting almost 3 weeks ago, but I was the one that asked for a postponement because the department didn't have a proper payment plan. My view was that I cannot go to the NHLS, the CEO, and just talk about the debt without having a formal payment proposal on the table. And that's the reason. Chair, we also acknowledge some of the historic issues, the corruption, the lack of controls in institutions and so forth. And we are dealing with those, but it's also a process that's taking a bit longer. There has been a lot of natural attrition in the institutions. There needs to be a lot of change management, but we are not saying that it's the problem that we want to use. But we're just saying that those are some of the things that we are confronted with. And Chair, now that we're going to have this technical task team, and in the meeting with the CEO, we've directed that their first meeting must be before month end, so that we can start on the right trajectory as per our proposal from the 1st of June. So Chair, we are on board to report more regularly if this is required by the Portfolio Committee, and we have also agreed as the CEO and the HOD, we will make sure that as a steering committee, we meet on a quarterly basis so that we don't just pay lip service to the agreement, but we can actually see real implementation. I don't know if the CFO, Mr. Sambo, would like to add, Chair, but I am covered. If you will allow, Chair, we can also ask the CFO to add if you would like to. Thank you, Chair.
Good afternoon.
Okay. Willie Sambo.
Good afternoon, Chair. Good afternoon to honorable members and MEC and colleagues who are in attendance. Just on one point, why we requested NHLS to write off, I think there's a debt of about 600 million or so. Chair, if you can recall during audit, during the COVID time in 2019, 2020, there was a special funding that was allocated to provinces that had to do with the COVID testings. So that special funding, it then ceased to exist immediately when the lockdown was stopped. So we remained with that debt. And we've been communicating with our provincial treasury so that the funds can then be allocated so we can then be able to pay this debt. But over the years since then, there's not been additional funding being allocated. Hence, that's why we then requesting perhaps maybe NHLS to consider perhaps writing off that debt because of the fact that there's not been additional funding allocated to us. But just to re-emphasize that the department is also committed to settle the current account with regard to the payment plan as indicated by the HOD. Current account will then be settled going forward in full, and then we'll then and also pay the monthly payments so that we then reduce the historical debt. Thank you very much, Chair.
Before you go, there's a hand by Honorable Mtuwatsi. What was the issue,
thanks.
Honorable Mtuwatsi?
There might be a bit of noise, but I hope you can. Not sure I'm worried by the. We're not in a political rally. We're not in a political meeting. We want accountability at the portfolio committee. And sweeping statements that would come and tell us as the portfolio committee that there's no money. What you see here, you see billions. I take strong exception of such assertions. We are not playing games here. We are serious. Some of the things that are coming through are worrisome, and that condescending attitude that comes from the MEC, I must say, it's unacceptable. We have asked many questions, and for me, many of the questions that have been asked, they're not actually being responded to as expected. I must say, and I'm encouraging. In fact, one of the things that I want the MEC to respond on is actually want the names of the people who are responsible. Want the names. Chairperson asked for the names of the people. What action has been taken? And we're just getting sweeping statements that are coming through. For me, that is condescending to all of them. The MEC, the CEO, and also in the CEO. It's totally unacceptable.
Honorable Clark, your hand is up.
Thank you, Chairperson. I couldn't agree more. I honestly think that the condescending way that the answers have been given to us, and half of them weren't given to us. Gauteng needs to put consequence management into their department in order to fix their department because of what's been going on in that department. And until such time, Chairperson, they are never going to be able to have any money to spend on anything because they have got such a huge debt burden because that department's been hollowed out through fraud and corruption. It's fact. We all know that. So I must just say, the answers we got really is really questionable. Thank you.
Okay, let me assist in the situation now. NHLS, you are on record saying to us that Gauteng has indicated that he cannot service the debt. Then we've asked the province, what is your official position to that effect? The province said they've never said that. CEO, NHLS, help us.
Thank you, Chair. So that message came through when we had a meeting with Gauteng before the end of last year, wherein we were discussing the issue of their debt. And the response that we had was that for the past year, which would be 25-26, they did not have enough money and they would therefore not be able to make any payments. In fact, they told us that they could only afford, I think, 200 million over that period. So Chair, just to clarify, it was for the last financial year. But now, as the acting HOD has said, we met with them this year, and these are the commitments that they are proposing to us. And this proposal, then they will submit to us officially, and we'll have it discussed with the board. because they are now looking at the current financial, at the new financial year, Chair.
So you are saying that was the status quo before the acting HOD came to the picture, and the MEC as well, she's just come in. So we have cleared that one. It's cleared. There's a commitment now, they are going to make sure that they pay. That's what it said.
Yes, Chair. Yes.
Then at the same time, I need to be corrected, HOD. The acting CFO has been in the department, right? It's not somebody who's coming outside from the department. Am I wrong or right, HOD? HOD
Yes,
Gauteng?
Chair. Yes, Chair.
Then that comes to that my question that I've asked. Who has been responsible for this NHLS account? And the acting CFO might has institutional memories. Maybe it's directly the person who can answer this question.
Yeah, we can allow the CFO and any of the members, Chair, if you don't mind. Thank you, Chair.
Yes, also to say this government policy of payment within 30 days has been there. I'm trying to reconcile the concerns as raised by members that you are not responding directly to the questions as asked. Yeah, those that have been there. I've got somebody with me with the name of Mr. Pakamisa, the accounts payable, chief director. This is the best person to be able to talk to us on this matter.
Yes, yes, Chair, absolutely. Mr. Jonas, please come through.
And response to the members' questions.
Good afternoon, Chairperson and the honorable members on call. My comment when it comes to the NHLS, I'm just going to, not specifically NHLS, the accruals as a whole. We had a problem, financial constraints. We had an accruals value of about 8 billion. And then we came with a accrual reduction strategy as to how are we going to reduce the accruals, not specifically NHLS, all the service providers that were owing their money. So now when we've analyzed that strategy, then we said we are going to pay about 70%, which is the current, and 30% for the accruals, of which we had opened, we closed with a balance of 8 billion in the previous financial year. But from that time up to the closing of the financial, we have managed to reduce the accruals, but close to about 50%, where we have closed with a balance of about 4.9 billion, not only goods and service, and also infrastructure. It was a matter of not prioritizing other service providers, but paying NHLS a certain amount of money, and then also paying other service providers. If I can also comment on what the NHLS CEO has mentioned, yes, it was towards the end of the financial year. We've got current obligations. When I'm talking about current obligations, I'm talking about the so-called non-negotiables, the medical supplies, the food, and everything, of which on a monthly basis we are spending about 1.1 billion vis-a-vis the money that we are receiving on a monthly basis, which is 1.2 billion. So we're only left with about 100 million for us to pay accruals. So that's what contributed that for us not to save service NHLS, not to save it entirely, but to pay a certain amount of money. But towards the end of the financial year, we said they wanted for us to settle the debt, of which we have indicated to them, no, we won't be able to pay you. We can only afford to pay you for the month of March. We can only afford to pay you 200,000, but we ended up paying paying them about 300 to close to about 200,000, if my memory serves well. That was the group by the end of the financial year. And then now in the beginning of the financial year, which was April, we only paid them in May, about this month, about 246 million, as the HOD has indicated there. Not because we did not want to pay NHLS, it was just financial constraint from my side. You can just pause the Honorable Chair. Thank you.
We seem to be getting anywhere. Colleagues, let's reconcile this so that we can be able to move. I think the MEC is on record. She has committed that she's going to come to us and report quarterly on this payment that deals with the issue of debt reduction and progress against the proposed settlement plan. So let's take it on that note. Unless there are direct questions that needed a response, like the one that I've indicated, that that's the issue. But I should think it's a first meeting. For the sake of progress, colleagues, let's take the MEC's word to this effect and the commitment she's making. And then I think I will give her homework to also go back, because I don't think the treatment of NHLS is the same treatment that all your debtors have been receiving. I don't believe that, MEC. So, because the way the acting chief, the person responsible for expenditure is saying it. So they just put everyone in the same bag and say, this is how we're going to do it. But I think when you do that, as somebody has said, you must first prioritize the service, the type of service that you get. And this one is the bloodline of your activities. We've emphasized the issue that if results are not tests are not conducted, there are lives that are affected. So it's all about getting your priorities right. Because if we were to say, go to your creditor's book there, you'll find that you might have been prioritizing certain things that you could have let go, but pay for these services. That's the message that we're trying to share with you. Can you, NHLS, is there anything that you want before I allow the MEC for KZN to respond? Is there anything that you want to raise on Gauteng before I release the MEC? Or respond to our questions that direct to you, NHLS, that are specific to Gauteng? Then the KZN ones, you'll deal with them after the MEC for KZN has responded.
Thank you, Honorable Chair. I'm sure maybe if the chair of the board also wants to comment, but I think just what's specific to Gauteng, and we can come back and address the other questions that were raised by the honorable members. So, but the point I wanted to just clarify is that the proposals that the provinces are putting on the table, we have just recently received this from the provinces. There has been engagements. I mean, because as executives, we have been communicating with the provinces for the last, I've been in the position for 24 months now. So we really have been engaging, most of the provinces. But to actually get concrete proposals that are presented to us, this has just happened recently. And I do want to just highlight to the members that we have not even presented the proposals to our board as yet. So there are no agreements as yet, because we need to look at what the proposal is and formulate a response as the executives and then present that to the board. And we agree with some of the questions that were raised, that there might be a need with the proposals that are coming through, that we need to engage with Auditor General of South Africa, we need to engage with National Treasury. So Chair, I just wanted to highlight that that has not happened as yet, because we have just recently received the proposals. Let me just end there. But otherwise, the other questions were generic and we can respond to them at the same time. Thank you, Chair.
That type of response, with due respect, CEO, it's a back and forth response.
Okay.
And that's why I'd ask a question on your part. When you realize that they were not paying you over the past 24 months that you are saying you've been on the job, what is it that you have done? Now we call them because we realize you have also been lacking on the side. We call these provincial departments here. They are making commitments, and then you come and tell us the board is still going to decide. Don't you think that then these meetings become a futile meetings? There's proposal that are put before us here. And I'm telling you so that even the board, then you are going to consider those proposals. But to me, this proposal is something like a commitment for these colleagues from the departments that they want to pay, and they're going to pay. That's why we're putting them to terms. Can you then come back to us in the next quarter? So I'm not preempting what will be the outcome. The beauty about it, all your board members are also here in this meeting. Because this is an intervention, realizing that it's a matter of concern. That's why we've intervened as Parliament. And the things that are the KPAs, and you've been there for 24 months. So that's why I'm trying to say, because I don't want an answer that is saying whatever they're proposing, if it's feasible and isn't it in your best interest that you'll be able to get the money, why will you tell us about the board that is going to still to decide, whereas there's commitment and on the part of the MEC? That's why I'm also saying, don't evade our questions as well. Because there's somebody who has been a CFO, you at the end of the day, also as an accounting officer, you have got the responsibility that revenue is collected in terms of the PFMA. And that has been neglected. Let me not talk about the other years that were, over the past 24 months, you have been seated with this problem. And the law gives you a remedy, what steps to take. But it has to take us as Parliament to come and say, let's address this problem. That's the point that I'm trying to give it to you, because there are questions that we ask. That's why I'm saying, talk to the issues that are related to Gauteng, because I don't want a situation where you are telling us they are proposing a plan. You are the ones that are making an allegation that in the past they've refused to pay. Now they are here. There's an new acting HOD, the acting CFO, the MEC has just got into the department. They are saying, we understand the tasks, the services that NHLS renders to us. And we are committed and we are prepared to come and brief Parliament on that. So your board matters, and then you have been sitting in those board meetings for the past 24 months with non-payment of Gauteng and KZN in particular. And then now we are saying Gauteng pay, you are saying the board is still going to sit. Don't you think that you are making this meeting futile? Who's Jeffrey Mpatlele, if I may ask before I recognize you?
Is the chair? I'm the chair of the board.
Oh, sorry. My apologies. Sorry.
Over
to you.
Because I thought I could save a bit of time on this one. And I do agree with you, Honorable Chairperson. The commitments that are being made here, they don't have to come to the board. Perhaps what the CEO was trying to articulate is the fact that there are some provinces like KZN with the historical debt, like the 4.8 million that you have seen on the slides. Out of that, over 2 million, almost 50% of that is really a historical debt, which has been with NHLS for many years. I think you have seen the years. And that is the one where the board will look at the proposal that KZN would have to put on the table and then and engage with that proposal, because I think from their presentation you could have picked it up that they are proposing things like settlement and so on. So we have not seen that. So I think we need to separate the two. I hope that helps. But the commitments that are being made now, we don't really need, they don't need board intervention anymore. And also from the management side, they don't need the board to collect the revenue. They have been engaging with the provinces and they've been collecting revenue where possible, but unfortunately, it was not 100%. So I will leave it here. Thank you.
We're getting somewhere. Is there anything that you want to put the Gauteng MEC before she leaves the house?
Not from our side, as the board. Yeah, I think we have taken note of their commitment. Thank you.
MEC Mazibuko, you are excused, but there are questions that are coming in writing that must be responded within 7 days. The other thing that I picked up from the team MEC, the invitation was issued 12 days on the 12th of May, 10 days ago. And then your presentation was only sent last night, late. Effectively, it means this presentation was received today, but in the morning. And in all fairness, you are in the same position. I don't think for members to fully interrogate, that's why I'm allowing members when they are saying they're going to send more questions in writing, MEC. And this is the things that in future, Parliament rule is that we must get presentation 5 days before the meeting. That's why you are given a 10-day notice. And these are the things that are within your fingertips. There's nothing that you're going to search and whatever, you get them. So, HOD, can we plead with you because the MEC doesn't prepare presentations. She signs off. Can you align ourselves with that deadline of 5 days before the meeting? That's why we give you a 10-day notice.
Absolutely, Chair. Absolutely.
Yes,
And my
yes.
sincere apologies for that. Thank you,
Thank
Chair.
you. Thank you. You're excused.
Thank you very much, Chair. Good afternoon.
Thank you. MEC Similane, are you ready?
I'm ready, Chair. Thank you.
Thank you. Yes.
Thank you very much, Chair. Chair, let me then just start with the commitment of providing a quarterly report to yourself and the portfolio committee on the process and how far we are with our repayments. We will make sure that it happens. Chair can give us dates on when or what becomes the 30th of which month, and we will align ourselves with that, Chair. I wanted to indicate, Chair, that on the current debt, we have a multi-year financial recovery plan where we have been paying all our service providers, Chair, not just NHLS, where we have been catching up on all our service providers because of the 24-25 challenges that we had financially. During the 24-25 financial year, Chair, it's not just NHLS that suffered with payments. It's all the service providers. We did not pay the private and not pay NHLS, and pay security and not pay NHLS. All our service providers struggled because of our financial situation at the time. As a result, we met with the Premier of the province, we met with our provincial treasury, and an intervention had to be implemented from that angle, and it was implemented. That is why right now we are on trying to recover, and we are on that recovery plan. I want to say, Chair, that in the last financial year, on the current debt, we have paid just above 3 billion rands because the intention is to try and bring down as much as possible the current debt with NHLS and eventually catch up with the services that have been rendered to us and are being paid. So I thought I needed to speak to that, Chair, and indicate that the current debt and the historical debt actually have nothing to do with corruption or whatever that has been been alleged, Chair. It is just challenges that the department, it is financial challenges that the department had in the previous year, and those are based, as I indicated when I started, on the cut on our baseline as a Department of Health in the province of KwaZulu-Natal. I want, on the historical debt, Chair, I want to make a commitment, because you were also speaking of consequence management, which is correct, but I want to make a commitment that we will go and investigate, because the historical debt starts from 2006 in KZN. That therefore means we will have to investigate 20 years going back. We will do so. If there are people in the system who should be held accountable, we will be able to do that. And probably that's something that we might want to add within our report or our quarterly report to yourself, Chair. But the fact that we've paid about 3 billion rands should be an indication that we are committed to reducing the current debt in particular. It became very difficult, Chair, on how we address the historical debt, because the majority of the people that were there when it was incurred are no longer in the system, and we couldn't agree between ourselves and NHLS on how much is actually owed. And eventually an amount of 2.5 billion rands was agreed upon, and there was a back and forth between ourselves as the Department of Health and NHLS, and what are the options that can be explored in ensuring that we settle this amount. It is that is the reason why the CEO is saying eventually in writing an agreement was sent not so long ago. But I want to say to you, Chair, I first met with the board chair of NHLS around 2022, 2023, because we wanted to agree on a way forward. And as a province, we wanted to confirm that we accept that we owe NHLS, but we do want a better way of settling that particular debt, because at the time we could not afford to pay the amount that are indicated and pay them upfront, because we don't have the funds. However, we have been negotiating and discussing. The head of department with the CEO have been meeting and exploring different options. As after that, the CFO of the department and the CFO of NHLS have also been meeting, and eventually that led to us having a concrete written proposal submitted to NHLS. And we are aware, Chair, that that particular proposal we cannot currently speak to, because it has to go to the board, and it must be the board that approves the proposal. That is why we at this point couldn't speak to our treasury as well, because we are waiting for the decision of the board for us to be able to move forward with that matter. On the legality of the agreement, Chair, well, we've got legal people. We have the NHLS also has its own legal fundis. They will be able to put it down and make sure that the document that we have put together is actually in line with the law. But I also want to indicate, Chair, that at some point much earlier on, a retired judge was appointed to mediate between the Department of Health in KZN and NHLS, so that we are able to get to a conclusion on how much was actually owed. And that is how we got to reach the amount of 2.5, because both parties could not agree, and then the parties agreed on a mediation process where a retired judge was appointed, and it led us to be where we are. But I do want to make that commitment, Chair, that on the current debt, we are committed to paying. We are continuing to pay. We only struggled in the 24-25 financial year because of our finances, but in the following year we then continue to pay. Hence, I indicated that we've paid about 3 billion after that. But Chair, can I request that the head of department be given an opportunity to respond in detail, maybe in some of the questions and in some of the areas that the members have raised. Thank you, Chair.
HOD.
Okay, thank you very much, Chair. I'll just respond to a few questions, particularly on the issues of financial management in KZN, emphasizing that we have a financial recovery plan that spans over a 3-year period that we have implemented in KZN to strengthen efficiencies in terms of financial management and internal control processes. And that financial recovery plan, we report on it to KZN Treasury on a monthly basis. And for the period 25-26, we realized a cost saving of slightly more than 1 billion. And we have identified a number of areas where we actually need to tighten the belt and improve in terms of our financial management and cost savings. We have also looked at a number of also issues in terms of what came up out of our audit recovery plan in terms of improving compliance, particularly around supply chain management and financial management, which includes initiatives like where we actually went to Gauteng particularly to go and benchmark on how they are managing their finances, particularly how they are managing their accruals, and even in terms of how we can actually stem the tide around the expenditure, particularly on COE, which puts us in a situation whereby in order to make sure that we are able to pay existing staff, we have to reprioritize the budget from goods and services to COE. And then as a result, then goods and services ends up being under budgeted for all the time. And this is coming from the historical budget cuts as early as 2021, where there were a budget cuts to the baseline that came up as a result of the underfunded wage agreements as well as the cost of living. Attention, yes, as a result of the fiscal consolidation. So as a result, we are continuously having to reprioritize the budget. But what we are doing is to prioritize the budget for the non-negotiable items. There are 14 non-negotiable items under goods and services, and laboratory services is one of those for which we do prioritize the payment for laboratory services. Hence, we have been able to pay. But because of the historical debt, we're not able to meet 100% the value of the invoices every month, and then also having to add a portion of the payment for the historical debt. But we are committed because laboratory services are part of the non-negotiables funding that we ring fence to make sure that we pay. So our efforts in terms of settling the historical debt are to ensure that in order to keep up with the monthly payments, we don't have the burden of the historical debt, because if we don't have the burden of the historical debt, the payments that we have done up to 3 billion in one financial year, we can even be able to increase on that, because on average, we are paying around 253 million to NHLS every month. However, we are a setback because of the historical debt, but also again because of our cash flow challenges. Because the cash that we receive every month is not adequate to cover all our debts for the services rendered. But we do prioritize our core business in terms of the non-negotiables. In terms of why did we continue to incur the debt despite the warning? Maybe one needs to explain, as MEC is explaining, that what happened initially is that what was happening was that we were paying a flat rate for NHLS, which means when we are paying a flat rate, then there is a portion of the debt that is not paid. NHLS then complained about that, went to National Department, went to National Treasury. Hence, as MEC is saying that then a judge was appointed, which then mediated between the two parties. So the debt, there was no time when the debt was not paid at all. It started with the issue of the flat rate, which caused the accumulation of the remaining portion. And then there was a time also where there was dispute in terms of the invoices. Hence, the process that we have now, when we pay NHL invoices, they have to be verified by the senior medical managers in hospitals in terms of the number of tests that have been done, where they have done, the number of patients, and the cost, and so on. And then they are verified at head office. So it's one area, including our electronic gatekeeping systems that we have in place to make sure that we actually also put in stringent measures to monitor the service without compromising the access to the service for patients. I must say there has been no patient in KZN who has not received access to any investigations because we have not paid. We monitor it. In addition, we have actually set up a provincial laboratory services committee, joint committee with the managers from NHLS, so that all these issues in terms of the management of laboratory services, the payment of invoices, are discussed. And so that there is that relationship where we're able to monitor the access to services, whether there are patients whose results are delayed and so on, including even the quality of specimen. I'm answering these questions because honorable members asked a number of questions around access to care, access to investigations, and so on. And these are the governance structures that we have put in place to ensure that there is access to care. And then also in terms of the agreement, as MEC has explained, hence when we presented on slide 11, we quoted a number of legislation and regulations and that will guide the agreement that if it is supported by the board, we are going to enter into for the settlement so that it is compliant with the PFMA, it is compliant with the National Treasury regulations, and all other processes are aligned to that. In terms of a service provision in KZN, we have a turnaround strategy for the department that we are working, that we have developed and we are implementing, and we are providing oversight in the provision of health services by particularly visiting facilities at least once a month, the whole senior management of the department. In other instances, we are led by the MEC to go and provide oversight in the provision of services. I'm just going to allow Mr. Shezi just to answer a few of the financial questions that I might have left out. In terms of the impact of the debt in rural districts and in eThekwini, as we have been saying, NHLS has a number of laboratory services, laboratories in hospitals, in community health centers, that ensures that all patients have got access to all the investigations that are required. So there are no instances where patients do not have to access to investigations and tests, particularly basic medical tests that are required. Thanks, Mr. Shezi.
Thank you. Thank you, thank you, HOD, and through our Honorable MEC. Thank you, Honorable Chairperson and members of the committee. Perhaps not very much to add in terms of what remains not cleared in terms of responses. just to emphasize on the fact that our financial recovery plan is indeed a 5-year plan, which was agreed in the course of the last financial year. So it's already being implemented and is already yielding efficiency gains, as HOD has indicated. And I think the root causes of the actual historical data have been clarified in terms of the differences between the flat fee and the actual invoice amounts that were actually billed over the years from the early 2000s, as has been indicated. Also, to just confirm that we pay for NHLS as a service through 2 sources of funding. First one being the conditional grant funding from the now grant. It's called the District Services Grant, but specifically the HIV/AIDS conditional grant. So that funding is earmarked and is indeed used towards disbursements of these invoices. And then the balance gets paid from the equitable share, which is where we are really finding it very difficult to actually meet our payment obligations, as have been explained, which then led to the financial recovery plan that's being implemented. I think that perhaps would be limited in terms of my additional input as requested, Chairperson. Thank you.
Thank you, Chair. I think we will pause there with the responses. Thanks, Honorable Chair.
Okay. NHLS, over to you now. NHLS.
Yes, thank you, Honorable Chair. I'm going to try and cover the questions, and then I'll allow the CFO to look at the finance-related questions. I think the clarity that I had wanted to make around the regulations as to whatever, and in fact, maybe just to clarify, as the chair of the board already highlighted, it was in relation to proposals that, for example, are talking to, writing off debts and, for example, the historical debt for KZN. But otherwise, the proposals, from the provinces, and for us as the NHLS, this is what we want to stress, and I did stress during my presentation, is that if the provinces can really commit to paying the current debt, it will make a big, improvement in our financial environment. So, Chair, the question around how do we manage to operate, in the face of such a huge debt? We do want to stress that it is not easy. We are finding that we have to identify priorities. And you find that even in identifying those priorities, when we do our budgets, we will have a list of priorities, whether it's replacement of instruments or it is, maybe IT-related equipment. But because we have a challenge financially, or it is actually with a vacancy, filling of vacancies, we are finding that we constantly have to reprioritize because we just don't have enough finances. So the point that we're making is, whilst we are managing to implement our mandate, it is with significant restraints because of the financial environment. And if this is not corrected, this is where then we are all concerned, and we therefore need to change things around. There was a question, Chair, around where we are sitting as far as our instruments are concerned. We have got aging equipment. We have been saying this, and the recent assessment that we did, it shows that about 13% of our current instruments have already reached their end of life. And therefore, in our planning, we need to identify what those instruments are and make sure that we replace those first. But like I'm saying, this becomes a constant, recalculating to identify what then becomes priority. And we have really engaged in recently, the board has approved quite a significant number of tenders to replace the instruments. And this is in pursuit, of overhauling our technologies. And there has been, and there continues to be commitment to improving even our IT infrastructure, as we have presented to the members before. And the other question is, for example, Gauteng is proposing a 3-year payment plan, for the previous debt, whilst they will pay the current debt. Is 3 years reasonable, Chair? These are some of the things that we need to look at, but from where we are sitting, we are saying whatever that the provinces can pay towards the previous debt, we will receive, as long as they can really make sure that they are constantly paying the current debt. And then the question, Chair, around the lack of servicing of the current debt has not really affected our referrals to the private sector. So this really has had no impact whatsoever, because the only reason we refer it is when it's a test that we cannot do within the NHLS, or it is because we haven't like the outsourcing, when we don't have sufficient pathologists to do the work. But otherwise, the payment of debt has not affected us in that manner. Chair, then you did raise some of that there are alternatives. There are actually options that we should be taking, and this is one thing that I will be taking up with the finance team to see really what are the mechanisms that are there that we should be taking up when when we're not getting our payments from the various provinces, and we will follow this one through. And around the issue of debt reconciliation, I think we've already heard from Gauteng, and we agreed that we want to establish a task team from NHLS and the various provinces that is then going to constantly look at any queries that might be coming from the province, so that there is proper reconciliation of the statements that are received. So, Chair, let me allow the CFO to respond to some of the specific, financial questions. Phumeza.
Thank you, CEO, and thank you, Chair. I think, Chair, the only thing I'd like to add to what the CEO has indicated is a response to the question in terms of our evaluation, that of the 11 billion, how much do we deem to be recoverable? So maybe, Chair, our assessment from the situation is that we've seen a deterioration. So, for example, last year we were sitting at 55% of what we built, and this year we're sitting at 53%. So our anticipation is that we are likely to recover around 40% if we are looking at the trends and how they've been going in terms of that. Then, Chair, maybe to comment to what Chair, what you raised around the dispute resolution. From our side, Chair, I think we were in constant engagements with the provinces, trying to find an amicable solution around the resolution of the debt. And that is why we also appreciate this particular intervention. And I believe that we also had mentioned in the previous meeting with the portfolio committee that we actually had, through our board, facilitated that we present this particular process and the challenges that we had to the NHC. And we were then given a platform that was led by our deputy chair and a presentation, our chair and our deputy chair, to then do a presentation to NHC so that we actually can escalate this particular issue. So from our side, Chair, we have been trying to find a solution around the servicing of the debt with the provinces to the best of our ability, mainly through interactions with the provinces. Maybe the last one from me, Chair, is the realistic financial sustainability, as asked by by Member Clark. So we are starting to see indicators that speak to the issues that we have in the servicing of the debt, and maybe also linked to the question that was raised on the percentage increase that we get versus what we request. And I'm not sure that there's necessarily adequate correspondence or details included in the correspondence that speaks to why we would get a lower than percentage. Our understanding, it is linked normally to what they assess to be, what is assessed to be the affordability in respect of the provinces. So we are still, for the moment, financially sustainable. But I guess our appeal, Chair, is linked to what the CEO has indicated, that please may we have 100% servicing of the current year debt, and then we are open to entering into negotiations with regards to historic debt. And we believe this would then assist with the financial sustainability. And then linked to that, we're also implementing cost austerities to make sure that we manage our costs, so we don't see significant increases with respect to our costs. Thank you, Chair.
Okay.
Yes, thank you, Chair.
We done to respond to the issues as raised by members.
Chair, we would like to believe we have addressed the issues, Chair. Thank you. I see that the board chair has raised his hand. Thank you. I'll hand over to the board chair.
No, just to confirm that we are done from our side for now. Thanks.
To welcome the MEC for Health in the Western Cape, Minister Wenger, with the team. As I give you the opportunity to, yours is not a big issue, but we felt we also need to interact with you, also to share with us if also there are challenges that you are having with the NHLS, because this thing cannot be one-sided. At some point, it's both sides. So I'll allow you to do that, introduce the team, then proceed. Then I'll allow MEC Manzini from Mpumalanga to also follow suit. Then I'll allow MEC from Limpopo to follow suit, because these are the three provinces that seem to be doing well. You don't owe, you meet your commitments. It's one thing that the others that are not doing what you do should learn the best practices. Maybe they must come and visit you, and maybe you have bilaterals and you share best practices. My understanding was that at some point, maybe you are minimac when you are meeting. There are instances where you share best practices. So I will then, in that order, that's how I want you to do the presentation. MEC Minister, you call Minister in the Western Cape, you'll talk to your issues, make a presentation, then followed by Mpumalanga, followed by Limpopo, in that order. Then we'll discuss your issues then. Over to you. I see the HOD, his microphone is on already. You can proceed.
Thank you very much, Honourable Chairperson, and good afternoon to all the members. Let me introduce the team on the line. We have our Head of Department, Dr. Keith Clitty, and we also have our DDG, Ms. Nkosi, who's the DDG of Corporate Support Services, who will be supporting us with the presentation today. So thank you very much for the opportunity to brief the committee on the working relationship that the Western Cape enjoys with the NHLS. And this includes matters relating to the payment of accounts. The NHLS is a critical partner for us in the healthcare system. Their work supports us to be able to diagnose patients accurately, to guide appropriate treatment pathways, and ultimately to improve health outcomes for residents across the province. We deeply value this partnership and the important contribution made by the 19 NHLS laboratories that are operating in our province. We saw the immense value of the NHLS, particularly during the COVID-19 pandemic, when the laboratory services were central to testing, surveillance, and guiding public health response under extraordinarily difficult circumstances. My colleagues will outline in greater detail during the presentation. The Western Cape Department of Health and Wellness consistently seeks to settle our invoices within 21 to 30 days in order to benefit from the discount structure available for services rendered. At a time when the public health sector continues to experience and operate under significant financial pressure, it's essential that we maximize every available rand to protect and strengthen frontline healthcare services. Chair, we remain committed to working constructively and collaboratively with the NHLS to address any challenges and to find sustainable solutions, always with the best interests of our patients as our foremost priority. And with that, thank you very much. I'll hand over to our Head of Department for some remarks.
Thank you very much, Chairperson. Thank you, Minister Wenger. Chairperson and committee members, it's really an honor for us to present to you today. We do so humbly. We have a very good working relationship with NHLS. And as Minister Wenger has indicated, we have structured our relationship over many years, and at the point where we are actively partners in rendering healthcare services together. There's a very important element of the NHLS that I just also think we need to highlight, is that we work very closely with our universities as well. And a lot of what we do is that NHLS themselves has got a relationship with the academic institutions, specifically at Grootskei and Tygerberg Hospital, which is with the University of Cape Town and with the University of Stellenbosch. And because of that three-way relationship, it's integrally part that NHLS is part of our ecosystem in rendering healthcare services. I've asked Ms. Nkosi to join us, Nonslansla. She is our newly appointed CFO. She also performs the function as the DDG for Head of Corporate Services, but in her capacity as a CFO, I would like her to invite her to do the presentation to just indicate to you what our financial engagements and interactions and processes is with the NHLS. Nonslansla, over to you.
Thank you very much, Keith, and good afternoon to the committee and to the chair, and thank you for the opportunity to present this afternoon on the Western Cape Department of Health and Wellness's interaction and engagement with NHLS. Chair, if I could just get an indication that my screen is visible.
We can see. Thanks, Anda.
Thank you very much, Minister. So just briefly, if we can outline the overview of our network with NHLS in the province. Minister has already spoken to the fact that we have 19 laboratories in the province, and most of those are situated within our hospitals, if not in structures that are adjacent to the hospitals, just for ease of access to the sites for the lab testing results. And we have our Greenpoint lab as our main lab, which is a multi-complex facility located within the city of Cape Town. The 19 laboratories are spread across the province, with the majority, of course, in the metro, given that the largest population in the province is in the metro. We have about 5 laboratories that service the Eden Karoo area in the Wildlands. We have 2 laboratories, 1 in the Overberg area and 2 in the West Coast. And these are categorized between the reference labs, which is your Greenpoint, and the labs in the Central and Tertiary Hospital. The regional labs are linked to our regional hospitals, as well as the district labs that are mainly within our main district hospitals in the province. So for those tests that are not offered at the regional and district labs, we refer those to the large reference labs as such. And we have the NHLS couriers collecting samples across the province at least once a day. And in terms of our interaction with them, the turnaround times for those samples are mostly acceptable and are within the timelines that are stipulated in the service level agreement between ourselves and NHLS. In terms of how we manage our accounts with NHLS, we are operating a very decentralized budget and cost center approach in the province. As a result, then the NHLS accounts are managed at local level by the respective managers who are responsible for their overall budgets, including then the payments for NHLS services, and the verification and payment processes for NHLS invoices, same as with other supplier invoices, are done at sub-district and at facility level. So how then the process works is that NHLS emails the invoices, statements, and necessary supporting documentation to facilities. And as part of that email, they put in that red receipt of mail functionality, which then counts and acts as the proof of delivery. And we use then that approach to determine the receipt of invoice date from whence to calculate then the 30 days from that process, because just between the end of the month and when the statements are received by facilities, there's normally about a 2-week window. So that's why then there's a mechanism of using that receipt of mail functionality to determine then when the actual invoice has been received by the said facility. And then we comply with then the payment within 30 days prescript as provided within the PFMA and the Treasury regulations. We also then make use of the early settlement discount, which is part of the payment terms and conditions that NHLS offer if full statement amount is paid within 21 to 30 days, of which a 2% settlement discount is given if the invoices are paid within 21 days of that receipt of invoice date, or 1% if payments are made within this 30 days, but beyond the 21 days. And Minister had spoken to the fact that we try to maximize our budget and we strive to make sure that we pay those invoices as much as possible within 21 days, so we can then benefit on the 2% failure, which we then fall on the 1%. And during the last financial year, we have received discounts from NHLS to the value of 17.5 million as a result of us settling the accounts within 30 days as provided. And we have done our age analysis presentation on the slide based on the 30th of April. And the presentation that the NHLS did earlier on was based on the March figures. But the message is the same regardless of whether you're looking at the March end of the year or you're looking at April. We have an outstanding amount as of April. It was 53 million in March. It is 91 million as at the end of April. But of that, 87 million is in current, which is the April invoices that were sent out to institutions by no later than the 15th of May. And the institutions are now busy paying those to take the benefit of the 2% discount or the 1% discount. So that's why then 87 million of the 91 is in current. And what is then within 30 days is 4.5 million of that. And really what is beyond 30 days, if one counts technically from the date of receipt of invoice, is only 727 rands as of the end of April. And if we then look at this slide, this is the slide that shows the total amount that we've paid to NHLS for 25-26. And the March figures reflect also the pro forma invoices, because we also try to pay as much as possible before the end of the financial year. And with also then the journals having been done post-closure of the books, which is why there's a slight difference between the total amount paid per the presentation that NHLS made. But by all accounts, we continue to pay the account diligently and within 30 days, as is reflected. And we average around 80 million payments to NHLS. And because we front load the payments in March, then the April payments would be relatively lower than other months because of that opportunity to also pay as much as we can before the end of the financial year. And then, Chair and honorable members, my last slide is on the our experience working with NHLS in the province. And by all accounts, and it has been confirmed by the Minister in Keith, we have a very good working relationship with the NHLS. And at the center of that relationship is actually the coordination of the relationship between NHLS management and the department through our provincial lab coordinator, who plays a critical role in the interface between the department and NHLS. And we do see NHLS as a valuable service provider and critical to the delivery of health services in the province. And as such, we have a relationship of trust, and that's based on mutual respect and appreciation of our collective purpose and objective as the two entities. We keep an open communication, and when there are issues that need to be addressed, which happen from time to time, we try to resolve those timeously in a respectful manner, and we communicate this and have protocols and mechanisms for escalating such issues, and with the provincial lab coordinator, as I say, being that central person. And we also work with the NHLS to ensure that we publish the laboratory-related information to health facilities on a regular basis. And we also ensure that any financial related information is also communicated to facilities in a timely manner, ensuring that our finance managers at sub-district and at facility level do have the information timeously, and they can also communicate with NHLS to resolve any statement reconciliation issues. And at operational level, we ensure that there's regular communication around issues of the laboratory footprint, if there are issues relating to the tests that have to be undertaken, and when there are new tests that have to be introduced. All of that is communicated in a way that ensures that the service platform is adequately serviced, and that the communication between ourselves and NHLS is maintained at all times. And from an ICT point of view, we are making optimal use of the tracker system to look up patient results, and also we have an interface of that system with our own single patient viewer, which is a provincial system that picks up data from different clinical systems, including a tracker that assists our clinicians to have a view of the patient journey across all the different facilities in the province, but also getting information from the different source systems. And with that interface with the SPV, we are also interfacing our NHLS expenditure figures onto our functional business units across the institutions. Keith has already spoken to the fact that through the good relationship we have with NHLS, they really have played a pivotal role during the COVID-19 period. And also the working relationship was further strengthened during the time of the NHLS security breach, such that as a province, we were least affected because we were able to respond early and use also the data capabilities that we have to sort of ensure continuity of service even at the time of that security breach. And more recently, when we experienced flood disasters in the province, we were working very well with the NHLS office to ensure that lab services continue uninterrupted during that period as well. So we feel that this relationship works because we are together committed and work towards solutions in the best interest of the patients, which is our primary consideration from both sides. Chair, that is our story, and thank you very much for the opportunity to present.
Thank you so much, Western Cape, for the presentation. And I then hand over to MEC Manzini and the team. Mpumalanga.
Thank you very much, Chairperson. Let me greet yourself and greet honorable members of the committee and the officials from the department and MECs from other provinces. For the first time, even ourselves today, we are being praised for doing well. We really appreciate that we are trying. It's not everything that is bad. We're trying our best in the province. What I will do, Chair, is that I'll talk to the additional notes that we are having, and then the HOD will speak to the actual figures and all that in terms of the payment. We want to indicate that in terms of the transportation of specimens from facility to laboratory and between laboratory according to their grading to conduct tests, we think that they can improve in terms of that. And of course, what they've already indicated, that there is a equipment downtime. And as I believe this meeting, Chair, is going to assist even NHLS as far as if they are getting payment so that they can be able to buy the equipment that they were referring to. And what is key also, what they also indicated is the issue of shortage of human resource, because some laboratories do not have enough staff to cover shifts, resulting in call-out system. And also we are working on the centralizing of tests in terms of the scope of services is aligned to the level of hospital tests that can be done at district, regional, and tertiary laboratory courses. So this, we think that is something that can assist us. But what we want is that also the decentralized test so that we can be able to have the test done at the level of the hospital, and a list of tests have been submitted to NHLS to decentralize from the tertiary labs to regional labs, and it is being considered awaiting outcome. I'm happy that in this meeting we do have the CEO, the chairperson, and everyone, so that if this can be fast-tracked, it can assist us as a province. We also want to indicate that the introduction of point-of-care testing, which is called blood gas analyzers in hospital, have reduced waiting time. So we really appreciate that they've done this, and we believe that this will also assist our clinicians in terms of making sure that they are able to treat our patient as fast as they will want to. And also the renovation and expansion of infrastructure by NHLS according to our service level delivery needs or at their own expenses. So we believe that this also is something that they need to do. And also the increase in terms of schedule of collection, because our request as a province was that we wanted them to increase the schedule of collection from once a day, especially at the level of a clinic and hospital, and we've got a positive considered that, so that at least twice a day. So want to indicate that this is what we have indicated to them, and we are getting positive response in terms of that. And also what is key, I think the CEO, the chair indicated the procurement of new upgraded equipment. New bigger analyzers are being procured and placed in facility on an ongoing basis by NHLS. So the more all of us will pay. I believe that this can fast track in terms of making sure that in all our facilities, we do have the bigger and upgraded equipment that they've started to procure and deliver to our facilities. And also what is key that we are also looking for is the use of the web view to access results, because the clinicians now will be able to register on the platform to access results on their mobile phones or computers in the wards to improve access to results. So we believe that this web view is going to assist us a lot. And also appointment of additional staff, motivation for recruitment for additional staff made to NHLS, where the department identified gross shortage of that negatively impacted on service delivery. And what we're also saying is that the soon to be launched electronic order form, where clinician will complete an electronic order form, the information will appear in the lab, so there will be no need to capture the request in the lab. So this, we believe that it will assist us also in terms of the fast tracking of the results that our clinician, because I also meet with specialists, and sometimes they raise these things, even when the minister was there at Mpumalanga, they raised this thing to say that if it can be done. So we want to appreciate that some of the things already they've started, and there are engagement in terms of them making sure that it is implemented. Chairperson, I'll therefore request the HOD to take us through the presentation in terms of the payment and also us as a province benefiting from paying within 30 days. Thank you very much, Chair. HOD, if you allow me, Chair.
Okay, so you are benefiting from payment within 30 days, MEC?
Yes, we are benefiting also.
Okay, she will highlight the critical aspect because I saw your presentation there too. State presentation.
Yeah, I should just highlight high level HOD because already NHLS have presented.
You agree with their presentation, it's okay. Thank you.
No, thank you very much, Honorable Chair, Honorable MEC, and all honorable members on the platform. Can I ask Secretariat to flag for me? I'll just start from slide number 9, because the first few slides talks about our service platform and our demographics in the department. But from slide 9, I think, to about 5 slides that I'm going to talk to, we'll just talk to where we are in terms of payments and everything. Yeah, on slide 9, we're saying that according to our records as a department, we have no debt owed to NHLS for the past 2 financial years, 24-25 and 25-26. And the last payment was effected in May 2026 for April invoice. And the department is awaiting invoices that will be generated end of May to be processed and paid within June. And because of the payment that we spoke about in terms of the service level agreement, if you pay within 21 days, you get a 2% rebate, or if within 30 days, a 1%. As a department, we've benefited 15.4 million discount for paying our invoices within 21 days for the past financial year 25-26. Next slide. The next 2 slides just shows the amounts that we've paid invoice, the date of receipt and the date of payment, and the amounts that we've paid. I think just shows that we are paying within either 21 days or 30 days. Even generally all our invoices, even the AGSA had commented on our average date payment for invoices about 18 days in the department. For everything that it's validated, we are able to pay irrespective of which account. The next slide also talks to, maybe you can move to the next slide without me reading. That shows that, go back. Shows that in the past financial year, or including the April, we've paid 899,253,000 in terms of NHLS. That's why then we are where we are in terms of not owing NHLS. The next slide just confirms that as a department, our record shows that we don't owe NHLS, and we recommend that the portfolio committee notes the report that we present. Then there are just issues that talks about turnaround times. I think the Honorable MECs also spoke about some of these issues. I'm not going to really speak to except that according to our service level agreement, there will be few issues maybe that needs to be taken care of as she has spoken to. Thank you, Chairperson.
Thank you so much, HOD. And then MEC Mashiho, are you ready with the team?
Thanks very much, Chair. Yes, we are ready. And good afternoon to yourself and all honorable members of the Portfolio Committee. And also greetings to my fellow MECs, HODs, and all the officials who are present on the platform. Chair, as the Department of Health in Limpopo, we must say that as well in terms of working very well with NHLS, we are doing that. We've got a good working relationship with them, and we have prepared, Chair, a short report that will be presented by the HOD. But what I can say is that also as the province, we are benefiting, Chair, in terms of the discount for payments within 30 days, which is a commitment that we are making that will continue doing like that. We'll try by all means that we respect that policy to say we pay all our invoices within 30 days. But Chair, I will request then the HOD, Dr. Ndwamatu, to take us through the presentation. Thank you.
Thank you, Honorable MEC. Greetings to Honorable Chair, Honorable members, all MECs. I would want to share from my side. I'm not able to do that. It says host disabled, or the slides that we shared can be shared for us. I will just talk to, because it's similar to the previous two provinces that has presented. If I could be assisted. I'm still not being able to share.
Dr. Ndwamatu, we are sharing for you.
Okay, thank you. If we can move on to the next slide. The third slide, I think we just stick to the terms of reference for the presentation. Thank you. So for Limpopo Department of Health, we also do not have any outstanding amounts with NHLS. If we could move on to the next slide. Next slide. So we are showing that for the financial year 25-26, we have paid 780.
HOD?
Yeah. Honorable Chairperson, maybe as the CFO, let me take over and continue with the presentation because she seems to be struggling where she is. When looking at this, current slide, it was just, a summary of how much we have spent on the year.
Wasn't it going to be better,
26?
Mr. Mudau? Was it not better to first introduce yourself that I'm Mr. Mudau, I'm the CFO, Chief Financial Officer, the department.
Thank you very much, Honorable Member, for reminding me. I'm Mr. Justice Mudau, Chief Financial Officer from the Limpopo Department of Health. Let me continue from where she has left. I would like to indicate that in terms of the expenditure that we are sitting on for the prior financial year, we have spent 782 million towards the NHLS. And I would like to also indicate that what Western Cape has presented as well as Mpumalanga is exactly what Limpopo is currently doing. The reason behind why we are doing almost the same is because at some point we went to an extent of doing what we call benchmarking process in order for us to learn the best practices, and we adopted them and implemented that in the province. At this point in time, you can see Limpopo also benefited almost 13 million as a result of paying well in time, and those were the credits that were given to the province. Can we proceed to the next slide? Now, this slide is just, giving a broader, summary of the payments that were done in the whole financial year, looking at, the date on which the invoice were, given to us and how much did we pay as the province. And at this point in time, we'd like to indicate that the province is sitting at a current in terms of the balance that is being owed to NHLS. Can we proceed to the next slide? Currently, we are looking at around 66.7 million. That is going to be honored, before the end of the financial year. And I would like to indicate that the province, as well as NHLS, they've got a very good relation. We are reconciling our accounts on the monthly basis, and we are making sure that the non-negotiables are 100% funded. At this point in time, the department is, financial viable to an extent that we are able to pay the non-negotiables and all other service providers within, the whole financial year. Thank you very much, Chairperson. Let me pause here.
Thank you so much, Mr. Mudau. I suppose, MEC, that concludes your presentation.
It does. Thank you very much, Honorable Chair.
Okay, then I need to get hands from colleagues. I'll be noting them. That's, those who want to interact. In that order, it's Honorable Clark, Honorable Marie, Honorable Kumalo, Honorable Liru, and Honorable Chirampungose. Can we start in that order?
I don't have many questions for the three provinces. I would congratulate the Western Cape, Limpopo, and I really feel that provinces like KZN and Gauteng that owe billions of rands to NHLS need to go and benchmark at these provinces to see how things are done, how systems are set up, and how you achieve these outcomes. Because by having good consequence management, good systems in place, this is what you see when you get presentation. To congratulate these three provinces and keep up.
Honorable Mare, Honorable Mare,
Chairperson.
proceed.
Thank you, Chairperson. Chairperson, I also feel we should give credit where credit is due. I want to say to the three provinces, Mpumalanga, Limpopo, and Western Cape, it is so refreshing to hear when they say they're having a very good relationship with NHLS. And it is so good for them to hear when they say when they make the payments on time, they get a discount. And it's so nice to see that they get credits back and they are saving a lot of money by doing things on time. And I want to congratulate them for the great work that they are doing. And I wish all our provinces can follow these three provinces and what they are doing. And in the Western Cape, I've been to a few of your clinics. I've been to a hospital with my mother because my mother's from Western Cape. And I must say the system that you are having is excellent. I wish other hospitals and clinics can come and have a look in what is really going on there. But Limpopo and Mpumalanga are very proud of you because the way you presented your things, I think the other provinces like Gauteng and KZN can really come and can learn from you. So congratulations. That's all I want to say, Chairperson. Thank you.
Okay. Honorable Komalo.
Thank you, my chairperson. Thank you very much. Let me also join my honorable members in appreciating and welcoming the presentations from these three provinces. But chairperson, I'm just having one question for Mpumalanga and Limpopo. I want just to check in relation to their department. That does the department believe the current budget is sufficient to meet healthcare needs and debt obligation simultaneously? I remember, Chairperson, you remember when we visited Mpumalanga on the oversight, the MEC of Health in Mpumalanga complained about this issue of small budget given unto the province. I want just to check how do they move around spending the budget that they are having and be able also to pay their obligation simultaneously. Thank you, Chairperson. This is for these two provinces.
Okay, Honorable Leroux, over to you.
Thank you very much, Chair, and thank you for the presentation from the three provinces. I just also want to extend my congratulations to the way they have serviced their debt and all their invoices to NHLS. I think that makes a huge difference to the entity to be able to provide the services that it provides that are crucial to the running of the healthcare service, and particularly the public healthcare service. And so I think that's that has to be credit has to be given where it's due. I think that I just had two questions. The one question was around, I wasn't clear, but I see that these three provinces prioritize the payment of these invoices because they see lab services as critical to the service they provide. Is there any sort of ring fencing of funding for that, or is it just that it's sort of when they decide how to pay things that is one of the top things that they need to pay? So I want to get a sense of, is there a ring fence, or is it just that they put it at the top of their priority list? Perhaps if they have any other things that they've done, and some of the provinces I know have had trouble with debt before. So what have they done differently the last 2 years to make this work so much better? Thank you, Chair, and well done again.
Thank you, Honorable Leroux. Over to you, Honorable Shiram Pongose.
Greetings once again to the provincial departments that have just gone and presented. Firstly, we want to also congratulate them. It's always good news when we hear that some parts are being done correctly. That's what we wish to be with the standard modus operandi. And I think because we've been so harsh on these provinces that we're actually speaking about, Limpopo, Mpumalanga, they always get the harshest end of the deliberations we have in this portfolio committee. So really, truly, we're happy to hear that they're on par with what they need to do. I think the questions that will suffice, Chairperson, is how do we then expand? And I'm happy that the MEC of Mpumalanga is raising this as well, to say we need to trickle down the capacity at regional level, at facility level, so that there's more efficiency. And my particular concern is in regards to remote areas, like in rural areas. How do we ensure that they receive equal service quality and turnaround time? And second to that, what is being done about shortages of specialists and pathologists, particularly in Limpopo? I'm asking this Chairperson following the ruling of the Concord on the certificate of need matter. Clearly, the national government, Department of Health, is failing to ensure that we have a proper system that's going to distribute services of specialists in remote and rural areas, with the failure to produce a working system on how certificates are going to be issued. But at a provincial level, how then do we work around this particular issue? It's a pressing issue. It's been a conversation for so many years that remote areas, rural areas, township areas are always alienated from specialist services and pathologists. So I want to hear, particularly from Limpopo, how do they ensure as a provincial government to expand this service and ensure that specialist services are a reality in their province? Ngiyabonga, Sihlalo.
Okay. We can then hand over to who's starting? Mpumalanga, then followed by Limpopo. Then if there are issues that NHLs want to talk to, it will be in that order. MEC Manzini, over to you.
No, thank you very much. As the HOD indicated that we do pay our account within 19 days, we go below the 30 days. So we try that in terms of the budget allocated, you know that this is budget is meant for this, and then you are able to pay, because we don't we know our budget and we procure services based on the limited resources that we are having. So hence we are able to do that. So even though as a province we are correct, we did indicate that we feel like we are the least funded of all provinces on per capita funding. However, as we get what you have, and with the limited resources that sometimes the provincial government give us, we prioritize the key things that we need to do. So it has worked for us over time, and we will continue to do that. The issue of the services that must increase in terms of our remote areas, you are correct. That's why we are saying that we are in discussion with NHLS, so that the services must come closer, so that we'll be able to get those lab in where the people are. And we believe that with NHLS we'll be able to find each other in that regard. And we also believe that in terms of moving forward, remember also the allocation that they gave us now, that will come for the 3 years, where we're able to, it assisted us a lot also in terms of making sure that where we have got challenges, we are able to close the gap, because the budget was like for your linen, your beds. So ordinarily the budget that you would have bought mama linen and bed and all that, I believe that that is the budget that we are able to do certain things. But this one is one of the priorities that we believe that we must pay, because you can't run any facility without the lab from NHLS. So we believe that the team working together with what we have, we are able to pay, because we know that if you don't pay, you won't get services. And if it can happen that we don't have NHLS that will allow sometimes not to pay, then what is going to happen to our people? So we try to say, with the limited resources, this is what we can do during with what we have. So NHLS is prioritized in making sure that as a cost driver, it's like medicine that we must always have in the hospital for us to be able to function. So thank you very much, honorable members. We really appreciate that you acknowledge our presentation. And indeed, we always work together in terms of benchmarking from each other. And I believe that also as a province, we can be open for that in terms of saying, with the limited resources, how then we are able to prioritize and make sure that you provide the services that is expected. Thank you very much, Honorable Chair and honorable members.
Thank you. Mpumalanga is done. Limpopo.
Thank you very much, Chair. I think I will joining Mpumalanga in terms of saying when it comes to the issue of budget vis-a-vis the debts that we have, we are saying, yes, we have pressures in terms of the budget. We cannot say the budget that we are receiving is sufficient, but what we know and what we do is that we understand that with the little that we have, we must ensure that we cover all the essential services that we need, and the lab services are part of those priorities. So that is why we ensure that with all the prioritized needs, we are able to fund with the budget that we have. Hence, we are working on a very tight budget to ensure that we are able to give services to the people of Limpopo with the budget pressure that we have. But then, Chair, in terms of our strategy, maybe in ensuring that we keep the specialists that we have, and also on attracting others to come into our province, I will then request that our HOD takes us through that, because indeed as the department, we are working very hard that we maintain the specialists that we have within the province, and we are also working on strategies to ensure that we attract more, because we know that we need specialized services within our province. HOD.
Thank you, Honorable MEC. Honorable Chair, apologies for earlier. I was cut off because of the network. So, in terms of the strategies that we have, Limpopo Province, we have. Let me speak first in terms of specialists. We have a medical school where we have pathologists which are linked to the NHLS in the medical school of Limpopo, and over the years we have been expanding services to all our facilities, especially our regional and our academics, and that assists training to proceed, so that we are able to train even the other specialists that we need in the healthcare system. And we have been supported through the grants that we receive from National Department of Health. So that has been ongoing. And we also, in terms of the other specialists, we have an open advert for all the specialists, such that if we are able to receive them from outside, or those that conclude their training, then we are able to appoint them. So, and with regard to the strategies that we have used with the budget, I think over some years back, we realized that we need to adopt some efficient strategies in order to save, reduce the wastages, start monitoring what is happening at all levels of our healthcare system. And over the years, we have realized that we were able to make some savings that have allowed us to then having sufficient in areas which are non-negotiable, which the CFO was explaining earlier. And Chair, if you allow me to continue to share on that. Thank you.
Yes.
Thank you. Let me just add by indicating that, the province, I think, for the past 5 financial years, we were able now to pay our service providers, including all the non-negotiables, for the whole financial year. And this process, came as a result of the strategy that was adopted. And the strategy which was adopted was, number one, we need to involve the line function managers in budgetary processes, whereby before you'll find that it was only a number crunching. It was only, it was
no. Who's Justice Fold 7? Who's Justice Fold 7? Okay, proceed. CFO, you were being interjected by somebody. Proceed.
Chair, if you allow, I think Justice Fold 7 is CFO.
Yes, it's me. It's me.
Okay.
Let me proceed. I was still indicating that we had re-engineered, the processes of, budgeting in the department, where we have involved all the line function managers, and we were very much, happy or, lucky, because line function managers that joined the department at executive management were all interested in working on the budgetary process. So I would like to also indicate that number two, we went to an extent of taking, a decision to advertise all the key spending item and make it a point that we have got what we call term contracts, so that institution, they only tap on the tap contract, because by so doing, we started to benefit on economies of scale. The other issue that, we have done is to make sure that when we allocate the budget up to the level of the CEOs, they must be orientated, they must be part of the process in order for them to start managing their budget, which is available. But I would like to also indicate to say, it doesn't mean that the province has a sufficient budget as the HOD has indicated. It just simply means that we go to an extent of making sure that we deal with the must-have, and all this other stuff that, we can do without, they are only funded as and when we have saving during the course of the financial. Thank you.
It sounds like a best practice. MEC Wenger, your parting shot, your last word, as there wasn't much issue, safe to say. The members have commended all three of you. What is it that you can say for those ones that are to present also?
Thank you very much. I'd like to thank the honourable members for the encouraging comments. They've deeply appreciated, so thank you very much. There was a question on ring fencing. If I may just respond to that.
Yes.
Thank you, Chair. We do not ring fence for laboratory services specifically. What we do have is a decentralized system where we have decentralized cost centers, and within those cost centers, we make sure that laboratory services are budgeted for, which enables us to then pay those invoices timeously. And I think that was the only question for us. So thank you very much to the honourable members for the engagement.
Thank you so much. We need to thank you so much. Also, MEC Manzini and MEC Mashiho. We need to go to the next batch of colleagues who need to present. What is the order, Secretariat? I'm going to go back to my agenda.
It's Free State, Northwest, and Northern Cape.
Northern Cape.
Yes,
Yes, thank you so much for that. Can I hand over to MEC? Free State first.
Honorable Chair, I hope I'm audible.
Yeah, those that have already presented, we can excuse you. We are fine. I see.
Thank you.
Milane has been here since
Thank you.
then, time in memorial. But I'm glad
Thank you,
now
Chair.
that you've also listened to the best practices.
Thank you very much.
Thank you.
The
Thank you,
next
sir.
quarterly report will improve, right?
Yes.
Yes. Yes, you have heard the three provinces, the model provinces that we have. Okay, proceed, MEC. Sorry about that. And that will also make you to then present much better now, I suppose. I think so. MEC.
Thank you very much, Honorable Chair. Let me relay my acknowledgements and observe the protocol that have been established to you, the portfolio committee, my colleagues, and the team from Parliament. And let me also acknowledge the NHLS team. Honorable Chair, I think we're going to make a very brief presentation, and we're just going to focus on the task that have been put in front of us. And we're going to talk about the outstanding debt that is due to NHLS for services that have been rendered. And we're going to talk about what have we been doing in order to deal with the backlog or the outstanding debt, as well as what efforts have we been doing to comply with the current account. And just to show that in the current financial year 26-27, we have already paid around 150 million in the past month and this month, just showing our willingness to resolve the matter with the NHLS. And we finalizing our proposal in terms of the payment plan. And once myself and the HOD are happy with the product, we will then have a meeting with NHLS before the end of June 2026, where our proper payment plan will then be presented. But as it stands, Honorable Chair, we are committed to fulfilling our obligations in relation to the current account, and we're going to be taking each other's hands with NHLS so that we can move forward. With that being said, Honorable Chair, I would request that you allow the HOD, Ndate Ernest Mohlahlo, and the CFO, Ndate Moremi, Moses Moremi, to come in and present our vision in relation to the NHLS debt. I hope the Secretariat would be able to give them the rights to be able to make a presentation. Thank you very much, Honorable Chair.
At least you are upfront, you are protecting your officials. They must be given the right to share. Is this the only delegation you are having, or you can take, as they are busy sharing, introduce the other team members that you've come with, Honorable Mahlatsi?
Honorable Chair, thank you very much. I was doing some work in the other side of the province, and I would request the HOD, whom I believe may be sitting with the team somewhere, to give an introduction of the team, and with due respect, Honorable Chair, just that I'm still in transit now. Thank you very much.
Makes sense. Thank you so much for that, MC. HOD, over to you. HOD.
Good evening, Chair, and good evening, honorable members. My name is Moses Moremi. I'm the Chief Financial Officer for the Free State Department of Health. HOD is having a problem with the connectivity where he is, so I'll go through the presentation if you so allow, Chair.
Well, can you introduce your other colleagues, if you have got some of them with you?
I am with Dr. Chris Leftrio. He's the Chief Director of Financial Management. And the other colleagues we have joined is Dr. London. She's the Acting DDG, Clinical Services. Thank you, Chair.
Okay, that's it.
Chair, this is the flow of our presentation. We actually stick to the terms of reference that were in the invitation letter. And these are the areas that I'll be covering in the presentation. Chair, the second up to the last bullet points is in terms of the terms of reference invitation. But what we did,
your slide is not moving. CFO.
Can you see it, Chair? Can you see it?
But your slide is not moving, CFO. Already
okay.
you are talking about bullets. Yeah, now it's moving.
Okay. No, thank you, Chair. Yeah, the first bullet is what we've actually included in the terms of reference that were given to us, so that we can demonstrate for the previous 5 years how have you been doing as a province towards the settlement of the NHLS account. Is this one visible, Chair? That's a 5-year financial overview of the budget
Yes.
versus expenditure. Thank you, Chair. We fund in the payment of the NHLS from two sources, Chair, which is the conditional grant, HIV and AIDS, and we are also topping it up with money from the voted funds. So if you check there from 2022, 2023, up to 2025, 26, I mean 26, 27 is just for 1 month, we're demonstrating the contribution of conditional grant and voted funds combined together towards the payment of the NHL account. You'll see there that 2022, 2023, the total budget combined is 400,671, which is a combination of grant and conditional grant and voted, but we paid 510 million, which is actually 127%. So what we've continuously been doing, and you can see exactly throughout the whole years, that we've actually paid more than what the budget we had. Towards the end of the financial year, where we realize that there are some savings in other programs, we now redirecting those savings towards the settlement of the NHLS account. So that's why you see that throughout, we've been paying, our expenditure is more than the combined budget of the conditional grants and the voted funds. Chair, as at the end of March 2026, the outstanding amount for NHLS was 372,778. Chair, but what we did, Chair, in the first quarter of the new financial year, 2026-2027, we actually released cash, and the dates are there, on the 10th of April and on the 28th of April and the 8th of May. These are the disbursement runs that we've had. We've actually reduced that 372 by 146,827. So what is remaining now in our books is 225,951. Maybe NHLS might still be in a process of trying to reconcile because these payments happened now in April and May. But that's the total that we've paid, and we've picked up the top 5 accounts. These are the hospitals that contribute almost the bigger part of the total 225, and there is Bitumelo. And if you look how much we've disbursed, we've actually disbursed more than what was due by the end of March, except for Tamufusa Yanda, where we paid 8.6 million. But the rest, we actually disbursed almost 50% of what we owed. And these are the top 5 hospitals that contribute almost the bigger share of the 225. All of them combined together, by end of March, they owed 161 million, 77 million was paid, and the balance for the 5 of them is 84. Chair, we are just demonstrating, in fact, I've done it for the past 5 years, but we're just demonstrating from 2023, 2024 to 2025, 2026, in terms of how much we've paid. You can see there that that's a total reduction of debt almost by 140 million, which constitute 38%. So there is a declining trend in terms of payment of outstanding debt to NHLS. We know that, Chair, the amount still owed is quite significant, for our province, Free State, with limited resources. But we try by all means to make it a point that at least we give attention to this, because this is one of the top non-negotiable accounts that we'll have to always make it a point that we pay. So this is just a trend in terms of the past 3 years, how it has been reducing. These are the measures that we've put in place, Chair, to try and manage this particular NHLS. In terms of primary health, we're looking at the alternative method of testing to be considered, especially at PHCs. There are some tests really that you may not need to draw the blood to do them. So those are the measures that we are considering there. Hospital care, we're also doing gatekeeping protocols to prevent repeat tests that are not needed across all medical disciplines. We need to utilize the early settlement discount to reduce. I think the previous 3 provinces that have already presented have actually demonstrated, and I think it's a learning care to us in terms of the benefits that they had actually derived by settling the NHLS account in less than 30 days, because there's some credits that they got. And this is what we're trying to do, that at least we're going to try and make it a point that going forward, we pay the current account of the NHLS in full, so that we can then begin to get some discounts while we are entering into a payment plan for the balance. Operational efficiencies there, that's what we will also be doing. Blood laboratory users committee to be strengthened at facility level to ensure optimal utilization of the services. Next slide. We also want to appreciate, Chair, the good relationship that we as a Free State Department of Health continuously is having with the NHLS. Even though there has been some outstanding debt due, the services are still rendered on a continuous basis. The feedback from facilities is that there has been no impact on service delivery or delays in service delivery turnaround times, even though we were owing the NHLS. There is a deputy director for laboratory services who continuously meets and discuss all the issues relating to NHLS with them, and then give us the executive management feedback on a continuous basis. Over and above that, there are continuous engagement, to communicate specific facilities and respond to the NHLS positively and timelessly. And then way forward, Chair, the department to continue assessing the underspending items and reprioritize savings. We will continue making it a point at the end of the financial year, if there are some savings, those savings must be redirected towards paying the NHLS, as we have demonstrated in the previous 5 years. And we also have to assess the HIV and AIDS so that we can see how we can increase the budget under HIV and AIDS grant towards reduction of the outstanding debt. This is what we'll be doing in the next business plan for the HIV and AIDS. We're also going to engage Provincial Treasury, Chair, that the revenue that we collect over and above the targets that the province has given us, that revenue be redirected to us so that we can then ring-fence it, and that money then be used towards the settlement of the outstanding amount while we are continuously paying the current account. The department to engage NHLS on efficiencies plan. In fact, Chair, the decision that we discussed with the HOD is that we were going to pay the current account. From now going forwards, we'll pay the current account in full. Before the end of June, we're going to submit to NHLS the proposed payment plan so that at least NHLS can look into it in terms of how we planned to pay the outstanding debt. But as I've said, that we've got a good relationship with them, we will also engage with them so that we'll give them the plan, the repayment plan as a draft to them to consider before they take it to the board. And if we agree, that will then be the final plan that will have to be adopted and taken to the board. And we'll make it a point here that we stick to that payment plan. The reason why we want to pay the current account in full, we don't want, as and when we are having payment plan in terms of the arrears or the outstanding amount, so that we don't pay the current account, because we don't want that debt to continue increasing. So that's why we commit on paying the current account in full and then having a payment plan for the payment of the remaining outstanding balance. That is the end of my presentation, Chair. Thank you.
Thank you so much, CFO, for the presentation. And then I think it's time I hand over to Northwest. MEC Leari, over to you.
Good evening, and thank you very much, Honorable Chairperson. I was driving, letting me park outside the road. Yeah, I'm fine. Thank you very much, Honorable Chairperson of Portfolio on Health, Honorable Ms. A.F. Mutambi, honorable members of the Portfolio Committee, fellow MECs from other provinces. team held from the province of Northwest, led by Dr. Tami Masehu, the newly appointed SG of the department. I'm with the top management of the department. Through you, Chairperson, let me request them to introduce themselves. From there, I will do the overview and I will hand back to the SG and the CFO to do the report.
Can the Superintendent General introduce all the colleagues that they're in a meeting so that we save time, MEC?
Agreed.
Thank you.
SG, over to you.
Thank you, Honorable MEC. Once again, good evening, Honorable Chairperson, Honorable members.
Appointed and fresh. Can we see your face?
My face, Honorable.
And is the first she voice we are hearing since we started this meeting? All the other issues, your colleagues were, maybe because you're called the Superintendent General yourself. That's why it's different. Over to you.
Thank you once more, Honorable Chair and Honorable members, Honorable MECs in the platform, and all my colleagues in the platform. Honorable Chair, here I have my colleagues in the platform. I've got the Chief Financial Officer, Memadire Rampedi. I've got the Head of Corporate Support Services, Dr. Madipuo Tlohani. I've got the Head of Strategy and Systems, Mr. Yanni Dibier. I have the Director General responsible for Hospital and Clinical Support Services, DDG Pulaki Mukatsani, and also I have Professor Tumbo, the Head of Clinical Services. Thank you, Honorable Chair, and over to you, Honorable MEC.
MEC Lihari.
Thank you very much. Let's do the overview. From there, I will hand over to Tim Held to do the brief entire presentation. Also, allow me firstly to express our appreciation to the Portfolio Committee affording the Northwest Department of Health an opportunity to appear before them in a Zoom meeting and present on matters relating to the debt owed by the Department of the National Health Laboratory Services, the NHLS. We further appreciate the continued oversight role played by the committee in strengthening accountability, governance, and service delivery within the public health sector. Chair, as the department, we fully appreciate the seriousness and significance of the disengagement, particularly because the NHLS remains a critical partner in the delivery of quality healthcare services to the people of the Northwest Province and the country at large. On the state of the NHLS debt, Honorable Chair and members, the Northwest Department of Health is taking the matter of the NHLS debt very seriously. We recognize the strategic importance of the National Health Laboratory Services in supporting the healthcare system through the provision of essential diagnostic and laboratory services, including disease surveillance, testing, pathology services, and the monitoring of treatment outcomes for patients across our healthcare facilities. I wish to assure the committee that the department has put in place key interventions measures, plans, and timeframes aimed at settling the outstanding debt and stabilizing the situation. The management team continues to engage with relevant stakeholders to ensure that commitments made are implemented and monitored accordingly. We remain committed to the strengthening financial management and safeguarding uninterrupted healthcare services for our people. In conclusion, before I hand over to Chairperson, the department acknowledges concerns raised regarding the NHLS debt and remains committed to finding sustainable solutions to improve the financial position of the department while protecting service delivery. With the permission of the Chairperson and the Portfolio Committee, I would like to hand over to the Spring General, Dr. Tami Masehu, together with the management team, to present the detailed briefing on the status of the debt, payments made to date, outstanding amounts, intervention measures, implementation plans, and timelines, as well as the broader impact on service delivery. We are confident that the presentation will demonstrate the tangible recommendations and corrective measures that have been put in place to improve the situation going forward. Through Chairperson, I'll request Dr. Tami to lead the team. Thank you very much.
Thank you, MEC. Superintendent General, over to you.
Thank you, Chair. Chair, we don't seem to be having sharing rights. May we request the host to help us with sharing the presentation?
Your MEC should have asked for that, like what the MEC for First State has done, on a lighter note.
I'm sorry.
I was advised to give sharing rights to Ms. Janine, which I have done.
Yeah.
Yeah.
Thank you. Thank you, Chair. Chair, Part A, I will request the CFO to take us through that because it talks about financial issues, and then Part B on service delivery, it will be Professor Tumbu, and then I'll close with the recommendation. Through you, Chair, over to you, CFO.
Thank you, Honorable Chair, and good evening, honorable members, and Honorable MEC, SG, and colleagues. Honorable Chair, I'm not feeling well. I requested my team to do the presentation. Though I'm here to support them, then I will also be responsible for answering the questions. Memekwe, our Chief Director, will be able to do the presentation. If you allow me, Honorable Chairperson. Thank you.
Thank you, Honorable Chairperson and committee members, CFO, SG, Honorable MEC. Let me just take you through the finance part of the presentation. The background, Chairperson, give an indication that as the Department of Health Northwest, we are underfunded. A study was conducted by the National Treasury together with the Provincial Treasury in 2022-23, which then suggested that the department is underfunded by around 2.6 billion at the end of the third year, which was 23-24. So we believe that the study was to see to it that perhaps the baseline for the department could be corrected, but we are still engaging Treasury with regard to that. Both the department and Treasury are working together to see to it that the baseline is corrected at the end of all. And when we look at the increase in terms of, or the growth in terms of the provincial budget, we can make a submission that we have a
a lower budget growth over the years. And when we look at the other provinces, I don't want to mention Limpopo, Mpumalanga, but in terms of national suggestion, is that the provinces should get at least 38% of the total provincial budget, but the Northwest is at 30% as we speak. And just to indicate that we funding our laboratory services from the conditional grants as well as the equitable share. Most of the funding comes from the conditional grants. That is just an indication of our budget growth over the years, which then suggests that more or all of the growth percentage-wise goes to compensation of employees in terms of your condition of your collar. Can I have the next slide? That also talks to the budget that goes to compensation of employees. We find ourselves having to fund compensation of employees and even going to an extent of shifting funds from goods and services to compensation of employees. Also, Chair, it saves to indicate that we've experienced budget cuts over the past financial years, all of the years, including even the 26-27 financial year. And the pressure is that when the budget is cut, you have to make sure that you fund the warm bodies, meaning that compensation of employees you are not going to touch, and the only place that you can touch is on goods and services. And let me also indicate that it is not only for laboratory services that the budget is cut. We, as the Department of Health Northwest finance team, make sure that the non-negotiables are protected. But as much as we protect the budget, there is no growth. We might just to protect the budget not to be cut. Can I have the next slide? That is the background of our accruals over the years from 2017-18 up to 2024-25 financial year. We're seeing fluctuations, but we see a huge growth of accruals in 23-24 emanating from the budget cuts, mainly where goods and services budget was reduced, and compensation was also increased from part of what was reduced from goods and services. But as much as the department will be trying to reprioritize and prioritize within the programs and the economic classification, the main issue is around what is reduced from the baseline. We want to appreciate the fact that we received an amount of 179 million from the National Treasury for 25-26 adjustment budget that was to be used for accruals and payables. And the Provincial Treasury also gave the department 60 million. We were hoping, Chair, that the increase in terms of the adjustment budget will then have a carry through over the MTF. However, the only amount that we received for accruals amounted to 82 million for 26-27 financial year. A larger part of this amount was then used to pay NHLS. You will see on the table that I'll be presenting later. So this is the indication of how we've been paying NHLS. I believe that members and the chairperson will appreciate the fact that we are settling NHLS on yearly basis, just that we always started with the amount that what was outstanding at the end of the financial year, and then after that we will then attend to the current year invoices, of which will then mean the budget is not enough to cover both accruals and the current year. And normally around October, November, the department will then start to slack in terms of paying accounts because of insufficient budget. And then that will then result in accruals. So looking at the bills or the billing for each year, when you look at 25, 26, just go back to that slide, 25, 26, we have a billing of 819 million, a growth that we can see from 24, 25 of almost close to 200 million in terms of billing. Hence, in terms of our financial recovery plan, one of the activities that we need to do is to look at our gatekeeping to ensure that we are billed accordingly by NHLS, as well as us as a department gatekeeping in terms of doing the tests that are relevant and appropriate. So for 25, 26, we've paid 559 million, which was including accruals from previous year. The next slide. The next slide. This is just a detail of what I have already presented. Go to the next slide. And we've engaged NHLS right from the beginning of this year, January, February, to see how best can we handle the issue on payment of our accounts. And the proposal that we submitted, Chair, was that let's start to service the current invoices from April 2026 and then enter into a payment arrangement for the outstanding amount of around close to 700 million, 600 and something. We are still waiting for the reply. NHLS says they still have to engage the board on that. So the intention is to at least pay around 200 million towards accruals this year, but pay all the current invoices on time. We are hoping to also negotiate and also realize some savings within through efficiency measures that we have introduced so that we can achieve our intention. Can we go to the next slide? Okay, thank you. Can I give over to Prof. Tumbu?
Thank you. Good evening, Honorable Chair and Honorable Members, MEC, SG, and colleagues. The second part is on the service delivery platform. Our turnaround time is the first item that we would like to present. The specimen's turnaround time is monitored through two platforms. There's a lab turnaround time, which is monitored by the laboratory itself. Basically, this monitors the time the specimen is received in the lab to the time the specimen is analyzed. And the second turnaround time is monitoring done by the facility. And this is a paper-based system, which is not very reliable. And it actually looks at the turnaround time from when we collect the specimen to when we receive the results. Our clinicians all have access to the web view online system, and this actually enables them to access results on the system without waiting for the paper-based results. This way, it has resulted in improvement in the turnaround time on normal day-to-day investigations. Next slide. In terms of the histology and cytology specimens, we don't have capacity to process these in the province, and NHLS basically takes these specimens to other institutions outside the province. The expected turnaround time for cytology is 14 days, and for histology is 4 weeks. By the current performance, we are already seeing a long extension of this turnaround time, where histology is now standing at about 6 weeks, and cytology is standing at about 4 weeks. So this is the only impact that we've seen in terms of delays in us receiving our results of cytology and histology, as indicated. That has been extended from the 14 days and 4 weeks to 6 weeks and 4 weeks respectively. In terms of the quality improvement plans, we would like to strengthen our internal controls for the lab services so that at least we reduce losses and unauthorized access. We have implemented the test invoice verification to improve billing accuracy and detect financial leakages. We have developed, we would like to develop a provincial monitoring framework with quality indicators and weekly feedback. And also we would like to review the centralization versus decentralization of the NHLS accounts and payment system so that at least we have more control over that. Key interventions in the short term, would like to centralize the NHLS accounts at provincial office. That would then ensure that we stick to the 30-day payment compliance. The electronic gatekeeping, which is already implemented, needs to be strengthened. We've already appointed clinical managers, specialists, and the key senior medical officers to then do the gatekeeping processes to make sure that at least we only request tests which are necessary. And also, we would like also to improve on our rational use of the laboratory services so that at least we use the cheaper rates which are normally done during the day instead of us waiting to request for investigations at night, which basically comes at a higher charge than what is done during the day. We would like to improve the clinicians' access to the web view so that at least we reduce reliance on paper-based results, and also start monthly joint reviews with NHLS so that at least we can monitor what is happening in terms of the results and the turnaround times. In the medium to long term, we would like to correct the departmental budget baseline, which has already been presented by the CFO. The issue of ring fencing, the historical date, and finalization of the payment in accordance with the financial recovery plan, which again, the CFO has alluded to. We would like to modernize our laboratory utilization management system so that at least we use test algorithms and this at least assists in fast tracking the tests so that we don't waste a lot of time. Would also plan to strengthen the district level clinical governance to ensure appropriate tests, ordering, and reduce wastage. And in terms of reducing wastage, we've already started implementing systems where, as I indicated, we minimize after hours tests. We also want to use the electronic order form because it actually controls the number of items that you can request from each of the panels. And a good example is a typical full blood count test on the old form would have 13 items that can be tested. And many times you don't actually need the results of the 13 items. For specific patients, you probably only need 1 or 2, and the electronic order form will allow us to be able to choose only the 2 that you need from the panel of 13. And that way you actually reduce wastage because some of them are being done when they're actually not needed. We would also like to improve the turnaround time, particularly for histology and cytology through the national provincial collaboration with NHLS. And this will also be responsive to our expanding oncology services in the province so that at least we can be able to provide services as quickly as possible to our oncology patients in the province. Next slide. I hand over back to the SG then to deal with the recommendations. Thank you very much.
Thank you, Prof. We are saying our recommendations that we are be crying a little bit about the budget cut. We're saying that much as we've developed these intervention plans, but if our budget baseline is not addressed, it may extend the period or the timeframes that we've given ourselves. Chair, we've also developed a financial recovery plan to improve efficiency on service delivery and prevent leakages. But however, Chair, we were inspired by the stories of Western Cape, Mpumalanga and Limpopo. As Limpopo was presenting, because we feel that we share similar geographic characteristics, as they were presenting now, we were also talking with them on our WhatsApp group. Our CFO and the CFO of Limpopo are speaking. We want to have a urgent virtual meeting with them sometime next week so that we can compare our financial recovery plan with theirs and see if we can factor some of the good practices in their financial recovery plan to factor it in ours and see if we cannot benefit from what they are doing and enhance our interventions. With those few words, Chairperson, thank you. I hand over to the MEC. Thank you, Chair.
I think that concludes your presentation, MEC.
Yes, Chair. And
Yeah,
thank you
it
very
does.
much. Thank you very much.
Yes, it does. Thank you so much. MEC Villakas. Northern Cape.
Good evening, Chairperson.
Yes.
Yeah. Thank you very much, Chair.
And welcome. Chair. Thanks for coming.
Thank you, Chair. Chair, I'm Nantobeko Vilakazi, the MEC of Health in the Northern Cape. With me, I'm with a team led by our acting HOD, Mr. Piri, and we also have our CFO, Mr. Javeron. So they will take us through, I think the presentation will highlight where we currently are. And I just want to say upfront that we acknowledge the seriousness of the situation. And I think we have also put some plans in place on how we want to deal with the issue moving forward. But I think, Chairperson Shuyo, without saying much, I will allow the HOD to lead us, and I think the presentation will give a clear detail, especially the CFO, in terms of where we are with our account from the past years up until where we are currently, and we want to welcome Chairperson for inviting us to be part of this. And I must say, we tried our best to make sure we don't hide anything. We will put things as they are so that the honorable committee members must have a taste or a sense of what is happening with regards our account in the Northern Cape. With those few words, I will through you, Chairperson will allow our HOD to lead us with the presentation. Thank you very much, Chair.
HOD, can you first do the honors of introducing yourself and the team? Then you can proceed with the presentation as directed by the MEC.
Thank you very much, Honorable Chairperson and honorable members on the platform, MECs and colleagues. Honorable Chair, my name is Kimutibile Opapiri. I'm the acting HOD for the Department of Health, Northern Cape. I'm with the CFO of the department, Refa Bruni. It's only the two of us in the platform, but we will handle the engagement, Honorable Chair. Honorable Chair, firstly, let me acknowledge the debt as presented by NHLS and also appreciate the relationship that we have with NHLS. We are in continued engagement with them. We have presented our problems, our frustrations to them. They understand that, and we are working on that, Honorable Chair, with all our financial constraints and our financial pressures, but we are in the process of developing a clear plan on how to pay the full account. Ultimately, Chair, I have agreed also with the team that once we have finalized that plan, we will be prepared to sign an agreement with a payment agreement with NHLS, and an agreement that will ensure that we don't deviate from it once we have agreed on how we're going to settle this bill. By so saying, I'll give over to the CFO to take us to other chairs. Thank you.
Thank you, Honorable Chair.
If you can slide the presentation, CFO.
Honorable Chair, we've requested the Secretariat to apply the presentation for us. Thank you, Honorable Chair, honorable members, MECs present, HODs, and colleagues around the provinces. I am Dennis Aberoni, the CFO of the Northern Cape Department of Health. I'll be making the presentation for the department. That is just a table of content. I think we can move to the next slide. The slide, Honorable Chair, is just trying to depict the status of how we manage the account during the 25-26 financial year. We have an amount of 248.3 million that was raised by NHLS through the 25-26 financial year. And as is depicted there, we can clearly see that the biggest share of that is in districts where we cover clinics, CHCs and district hospitals. And the second highest would be our Provincial Tertiary Hospital, Robert Mangaliso, Sibuko Hospital, and the third largest will be the Regional Hospital in Upington, the Dr. Harris Hospital. Now, in terms of the payment, we fell short a bit because of the 248, we paid only 198.2 million. So at the end of March for the year 25-26, we had an outstanding balance of 50.1. However, we are saying we had a March billing of 23.4 million that would ordinarily be paid in April, which means really at the end of 25-26, we had an outstanding balance just over a month billing for 25-26. So we are paid 80% of our debt at the end of 25-26. I will just highlight certain issues that we discussed with the NHLS later in the slides. We can move to the next slide. This slide just indicate what I just said, Honorable Chair. The last bullet is just trying to indicate the challenges that you are faced with, the issues of competing demands, because NHLS remains just one of the accounts that we are challenged with. However, is the biggest account. It makes up 50% of our accruals in the department. So it's an account that needs serious attention within the department. If we can move to the next slide. This slide, Honorable Chair, now deals with the total debt of the department to NHLS. The first one was just dealing with the movement of the year. This then deal with the entire balance of the department. Now, as at the end of March, our debt was standing at 523.8 million. And our biggest concern is the districts. We are not overly concerned with the Provincial Tertiary Hospital because we believe and we have engaged them and we believe that they can be able to handle that outstanding debt of 15.2 million. The regional hospital is a bit of a challenge, but we have a plan in terms of how we are going to deal with them paying, at least for starters, their monthly accounts. The account, the balance, we've got 23.4 PT in 30 days, and the rest is 30 days plus, which means the bigger part of that account is account that are spending a period of over 30 days, which is an area of concern for both us and for NHLS. Next slide. If we can move to the next slide. Thanks, Chair. The account was being managed, I won't say well, but we were almost in range. But the COVID-19 challenge created deeper problems for us, because since then, when we created the COVID-19 account, the account rose to a level where we are now struggling to deal with it. However, we are hopeful that with the engagement of partners that we have, we will be able to start to deal with the area payments on this particular account. Next slide. Honorable Chair, we thought it was important for us to present this slide. You know, it wasn't part of the terms, but we felt that for us to be able to explain ourselves properly, we need to show the committee the challenges that we are faced with. Now we highlighted only one line on this particular slide, because this is our budget for 25, for 26, 27 moving forward. Now, what we are trying to show, we are just trying to show that our budget for the current year, 26, 27, on goods and services, because there's a line item that will be servicing NHLS as one of our service providers. Is has just had an increase of 1.5%, and the recommended increase by National Treasury was 3.6. However, we failed to meet the threshold of 3.6, 3.6 of which is ordinarily itself less than the running inflation that we are faced with now. So that clearly shows us that we will be faced with challenges in trying to service all, in fact, of our operations, whether growth that we are faced with. Bearing in mind that our accruals as we speak now are standing at 1.1 billion, and of that 1.1 billion, we've clearly seen that the 5.3 of that will be NHLS. So we are faced with a scenario that really needs us to think differently and to engage all the officials within the department for us to try and see how do we move forward. There's been issues of cooperation, there's been issues of twinning, there's been issues of pairing that we're involved with, just for us to be able to try to learn other interventions that we might implement in the department for us to be able to deal with the situation that we are faced with. Next slide. There's just the issue that I've just raised. Now we can move to the next slide. Thanks, Chair. Now, in terms of the measures, plans, and timeframes, we were very cautious in coming up with plans, Honorable Chair, because we didn't want to sound realistic or present a plan that was going to fail the very next day once it has been signed. One thing that we are confirming and one thing that we are committing on is the monthly billing. Now, we've set aside an amount of 257 million, which is an average of 23 million that we have set aside for them to service the monthly billing, because we believe that in any engagement, whether with the National Portfolio Committee, whether with NHLS, cannot be smooth if we don't guarantee the payment of the monthly billing. So that 253 is an amount that we have set aside and is managed from the office of the CFO. We have basically centralized the payment of the accounts of the district and Dr. Resurti. Our provincial Technical Hospital can take care of itself. All we'll be doing to it will be monitoring. So we are committing that the monthly billing for NHLS will be settled. We've had engagement with NHLS. The last one that we had was in February 2026. And in that engagement, we had agreed that we will draft a settlement agreement that we will submit to them for them to review and feedback. And that the service level agreement will include the payment of the current service rendered in full and timelessly, which means the issue of the 1% and 3% we need to start to benefit on that one, because it don't assist us to pay the account fully every month and not try to benefit from the discount arrangement that that NHLS had. Now, if we move to the next slide, Chair, the reason why we haven't come up with the finalize our settlement agreement yet is a challenge that we are faced with in terms of sourcing additional funding, because we are currently constrained in terms of sourcing additional funding for us to be able to service the debt in addition to the monthly billing. We are engaging Provincial Treasury. We have already engaged Provincial Treasury. There is a promise whereby they've already indicated that it cannot be at the levels that we are expecting. We are engaging National Health. National Health, the previous financial year, they did allocate some funding for accruals, although it was not sufficient. But those are the two partners that we are looking into in terms of the assistance that we are seeking. But the assistance, Chair, is not only limited to the funds; it's also limited in terms of the assistance that they can offer in terms of the entire management within the department. The measures that have been introduced, the measures has always been there. I think the challenge has been the resource to monitor such interventions. For instance, the gatekeeping arrangement or intervention has always been there. The only problem has been how we've implemented it and how we are monitoring it. We've therefore requested Robert Mangalisa's Book Hospital, our tertiary hospital, to then assist us in dealing with this issue at district management level, at our regional hospital, which is Dr. Resurti, because they are implementing measures that are assisting. I think there was an official in Northwest who mentioned all the interventions that Northwest is following, which we are also implementing, particularly at the tertiary hospital. We just need to make sure that we roll them out to our other facilities, lower level facilities, and we are, of course, engaging the tertiary hospital to assist us with that. Now, the way the discussions have been going, Honorable Chair, it has put a little bit of pressure on us. Now we've had a discussion, and we have concluded that the settlement agreement must be fast-tracked, and by the end of June 2026, we should be presenting a settlement agreement to NHLS for their consideration. We also believe that the twinning arrangement that we just agreed on as a sector will then assist us also to look into other interventions. I've heard Northwest saying that their CFO and the one of Limpopo are talking. I want to believe that that will be an opportunity missed if I also don't really join the group for me and the department, because I don't think it is only limited to me. Me and the other colleagues within the department will be interacting with provinces, the three provinces that are doing well in terms of this account. Lastly, Chair, there was a question that asked whether there is an impact on services because of non-payment. For now, there is none. But when I presented this to my MEC asked a question: till when? Till when? Because there's a risk. NHLS might be running into trouble with their cash flow, which might not leave them with any option but to start to suspend certain accounts. Now, it is very clear that we need to speed up the process of developing and finalizing an agreement that we can be able to service. I said earlier that we are very cautious because we have tried that before, but it failed the moment we have signed, and we don't want to go into that scenario again. Well, that, Chair, I think it will be the end of the presentation for the Northern Cape Department of Health. Thank you.
Thank you so much. MEC, I think that concludes the presentation.
Thank you very much, Chair. Yes, that was our presentation. Thank you very much.
Okay, thank you so much. Colleagues, can I see a show of hands of colleagues who want to interact with the three presentation? Free State, Northwest, and Northern Cape. Okay, for now, I've got two hands, Honorable Marie and Honorable Sine, and then Honorable Shirwa, in that order.
My hand, Chair.
Your hand, Chair, is Honorable Kumalo. Or Fisani?
It's Fisani, Chair.
Okay, thank you. You'll be the fourth one, in that order.
Thank you so much, Chair. I want to say thank you to these three provinces for the presentations. I want to say that the Northern Cape had a very full presentation where they even outline what is going for goods and services. And in that slide, I could see the payments as well as salaries and things. I just need to understand, Northern Cape has been very honest by saying that they have a short flow and they would like to make an arrangements with NHLS to see how they can sort the problem out. I just need to know, when are they going to speak to them? And what arrangement are they going to make? Because they have emphasized so many times that they have a shortfall, they have a problem, they're trying to work around it. It is not the provincial, but it's the regional hospitals that is having the problem. I just need to know, what are the plans they have in place for that? What is the timeline that they are working on to sort this problem out? And how are they going to do it? And then for the Northwest was saying that they were going to use again from the money from the HIV funds that they're having there. I just need to know, if they use the HIV/AIDS funds, is that going to be a shortfall of medication for HIV/AIDS patients? And also, what is the timelines that they're going to have for the payment plan that they're going to have, and how they're going to sort that out? And then I want to go to the Free State. The Free State, the MEC, I'm from the Free State. The MEC knows me very well. I just need to find out from Free State. They had a very good, clean governance on payments and things, and I think the payments slack when the new government, after the 2024 elections, new people came in, and the budget is not enough. I just want to find out from them, is that what are the plans that they have in place to make sure that these payments are being paid on time? How long is it going to take them to sort this out? I know for a fact that Free State is having a massive problem with the Department of Health, but not with NHLS. So that is what I would like to know, how they're going to deal with that. And then also the question that I would like to know is, because we know there's a shortage of staff, maybe in all the hospitals and clinics, is some of these monies going for overtime and things like that? They have a problem not paying the NHLS. So I just want to know, what is the plan that they have in order, when they're going to discuss this plan, and how long is this thing going to run? Because if you look also at their budget, there's also a shortfall, and I just need to understand what are the plans, because Northern Cape has to take us into confidence about all the issues, and where the others, the Free State has not done that. So I just want to know that. Thank you so much, Chairperson.
Thank you so much, Honorable Mare. Honorable Sene.
Thank you very much, Chairperson. Let me also appreciate the three presentations. Chairperson, quickly on the Northwest presentation, Chair, I just want to check with the province if the province experienced any disruptions, delays, or limitations in laboratory services due to this situation that they find themselves in. And Chair, given that the conditional grants, we all know that are allocated for specific health priorities, can the department assure the committee today that using the grant funds to settle the NHLS debt will not compromise frontline healthcare services and also infrastructure projects, human resources, and other critical programs? I just want us to have that assurance, Chairperson, that the grant that the province is using, it's not going to affect. And Chair, let me also just take this opportunity to put a proposal that I think, Chair, as a committee after here, we should consider convening a meeting with the National Treasury and also the department, the minister, and maybe only the affected province to assess whether the current budget for all of them is adequate, and also the National Treasury in terms of how best can they assist these provinces to operate effectively. Thank you, Chair. Oh yeah, the next one, Chair. Maybe we also need to request the defaulting provinces to submit quarterly reconciliations and payment verification reports directly to the portfolio committee chair, so that we also monitor their compliance with agreed upon. I mean, they've made payment plans they've presented to us today. From here is for us to monitor. And thank you for the Superintendent General to inform us that they've already started talking. I think this was a productive meeting, Chairperson. Thank you.
Thank you, Honorable Sinne. Honorable Shiro, over to you.
Yeah, Bumpasalo. Greetings again to yourself and the provinces that just went. To Northwest, these are our questions. We want to find out what's the reason behind the sharp deterioration of Northwest, because they previously were having a good payment record. I know they gave us a few details in regards to this, but I think if they can make it distinct and concise on what the actual cause was for this regression, that would really assist. And second to that, we want to find out how mining communities are affected or suffering due to the weakened pathology and occupational health services in the province. And we're asking this, Slalo, for many reasons, but I think most prevalent is the fact that the mining sector has a lot of responsibility in the communities in which they find themselves in. And we know that in how they fail to hold up those standards becomes a thing that severely affects these communities. I think if the province can just appraise us on what the situation is in relation to that, especially because we can't just look, when it comes to mining communities, we can't just look at the government. There's many responsibilities that mining companies have in terms of serving the communities where they exist in. And I think even on that part, we should be able to ask questions relating to that. And then thirdly, we want to find out what impacts their current situation has had on TB surveillance in mining belts. And in regards to Northwest, we want to find out if there's any delays in surgeries and treatment of patients because laboratory support is currently compromised. If they can give us a detailed response to this question on which facilities are facing this particular situation, if that's the case. and which way is it fragmented the most? How is it fragmented? How is it disfigured in the province? And to the Northern Cape, we want to find out how the current vast travel distances and sparse healthcare infrastructure impact or worsens diagnostic delays in the province. And number two, if patients in Uppington, Kuruman, and Namakwaland are waiting longer for test results due to resource shortages. And lastly, we also want to find out if understaffing in remote facilities have worsened laboratory inefficiencies. That's for Northern Cape. And then for Free State, we want to find out if there's a report that they were able to reduce their debt, and we want to find out if their modus operandi is sustainable for the future, because even if they were able to do that in this term, I think we should be able to see if this is a sustainable modus operandi that the province is employing, or if there will still be issues that suffice. And we're asking this with awareness that, at the center of it all, I mean, even with all the provinces that are involved, even the bad performing ones, with the exception of Gauteng and KZN, I think those are bad situations. The austerity budget really does have an impact on how they're able to administer these functions, like of paying, right? But there must be a separation that when it comes to the public sector, to public entities, they must be prioritized, because we're a public sector. We can't be a system that neglects its own capacities and deliverables at the expense or compromise of the public sector while prioritizing the private sector. Lastly, for Free State, are their pathology services and oncology now fully stabilized? Ngiyabonga Sihlalo, those are our questions. Ngiyabonga.
Thank you so much, Honorable Chirampungose. Honorable Fisani Shabangu, over to you.
Thank you, Chairperson, and good evening to yourself and other members of the platform. Chair, let me also join others in appreciating the report that we have received. Chairperson, we are here dealing with the service, the National Health Laboratory Service, which is a critical statutory service in the Department of Health. I'm listening to the presentation, Chairperson, and I must be honest that listening to the presentation, I can't put a finger to say, is it the debts that they are talking to, is it due to absolutely lack of budget, or the funds were diverted to cover other operational costs? I'm asking this, Chair, because I'm looking at the millions. All the provinces, they are owing. It can be a 1 million, it can be whatever. Some it's up to 200 and something million. And how do you expect the National Health Laboratory Services to operate effectively while so much and so many millions is being owed by the provinces? The services that the NHLS is providing, it contributes to the treatment of patients. And owing so much, it will collapse the services, and some results might delay, even if they don't tell us. But there might be some delays because there's lack of whatever resources that the laboratory is needing to actually deal with the results. So I'm really worried, Chair, because if you put all together what the provinces are owing, it's a lot of money. Then you ask yourself that if it was a private laboratory, would they be owing so much? Or there's that leniency because they are here, we're hosting them, it's a government entity, the questions that I had, I was widely covered by the speakers that spoke before me, because I wanted to know about the timelines, and I wanted to say that as a portfolio committee, we need to strengthen oversight to actually require the submission on a quarterly basis to look at the compliance and the means that the effort that the provinces are doing to actually deal with whatever that they are owing the laboratory. The other thing that I wanted to check, I'm not asking different, provinces, separating them. This is general for all of them, because there's no one who is clean here. The other thing that I wanted to ask earlier, Chair, you'll forgive me, that there amongst these provinces, there are those that I think it's Northwest is one of them, Limpopo, Mpumalanga, that they transfer patients to Gauteng for services that cannot be provided in the provinces. So I'm looking at the debt of Gauteng, and I'm asking myself if, because I remember while I was still in Mpumalanga, there was a time where we were expected to pay some money for the patients that we transferred to Gauteng. So I'm asking myself if it's still like that, or there's a separate budget in Gauteng for all those patients that are transferred to Gauteng, because Gauteng might be owing so much because of the provinces that are sending patients there, and they do not contribute. I'm just asking that question. It might be the question that has been asked while Gauteng was presenting, but it just came to my mind as other provinces were presenting. But generally, Chair, I was widely covered by the honorable members that spoke before me. So I want to end here. Thank you so much.
Thank you so much, Honorable Shabangu. Can I task the MEC in the order in which they presented? It will be Free State to respond, then Northwest, then Northern Cape, and then the NHLS will come at the end. Can we do that, MECs?
Honorable Chair, thank you very much. I think we will start. And let me give over to the HOD in the Mhlahlo to deal with the questions that have been asked. I think it's not many, but the HOD will deal with them. Through you, Chair, and Mhlahlo, please come online and respond to the questions.
Thank you, MEC and Honorable Chairperson, Honorable Members and MEC colleagues. I will start with the questions that were asked by Honorable Murray. In terms of the balance of 221 that is due, we are committing to submitting a credible payment plan by the end of June. And we are also making a commitment that our payment plan will not go beyond the 2026-2027 financial year in terms of the amount that is due. And at the same time, we are going to do everything in our power to ensure that we maintain the current account. The other issue that was asked was around the plans that we are going to employ over and above what the CFO has presented. One of the low-hanging fruits for us as the province of the Free State is that we have not been doing very well in terms of our revenue collection. That is, REF, Road Accident Fund, Correctional Service, Justice, the government of Lesotho, and we have, started engagements with these key stakeholders, And we are owed over 600 million by those stakeholders, and there is positive progress that we are making. So just by focusing on revenue, we will then be able to address our accruals. But beyond that, of course, our patient fees as well are not being collected properly. And we are putting plans in place for this current financial year to ensure that collection happens so that we are able to also contribute from own revenue. But the second issue, Chair, is that the last financial year, over and above the payments that we made to the NHLS, we also generally had issues around accruals in general, whether it is medicine, whether it's contractors, etc. But we were able to reduce our overall accruals by 30%, from 1.3 billion to 949 million, meaning that we have we have eased the pressure for the current year so that we can focus on other remaining accruals. So in the previous financial year, at least our accruals for linen was put under control. We have also dealt better with our medicine. At some point in the province, in 2024, we could not afford to pay for medicine. But this year we paid for medicine for the entire financial year without any challenges. And by just putting those under control, we will now be able to focus fully on others, including, and of course, prioritizing NHLS. The other issue that I want to respond to is just to confirm, Honorable Senne, that we are going to submit quarterly reports, and we will also submit the reports in terms of the implementation of the agreement that we will propose for consideration. And in relation to the main, Honorable Chirwa, I think you raised this question for the other province, but I think is the same for us as well in the Free State, that we've been doing very well until a point in time in 2022-23, and that was as a result of a baseline reduction in the budget for health that actually affected the Department of Health. So we are still trying to recover from it, and the only way for us to recover is to increase our own revenue, but also to improve efficiency in terms of how we do things. And I will make an example, Chair. We have done an assessment of our goods and services, and we have identified areas where we are not efficient. For an example, over the last 3 years, we spent close to, I think, about 30 million just on different types of printing, items and paper in the main. And this year we are implementing a project where we are going to digitalize fully our submissions. So we anticipate real savings there, but we are also optimizing our services generally. But I think maybe at a different platform, we will also, provide more details in terms of how we are optimizing, our services. Now, with regards to CFO, I'm not sure if I left anything out. Maybe you can come in if there's anything else that I've left out. Thank you, Honorable Chair.
Maybe Dr. London can come in, HOD for the pathology and oncology. Honorable Shiro wanted to check whether that has been stabilized. Thank you.
Dr.
Thank you,
London.
Honorable Chair. Thank you, Honorable Chair. Good evening, Honorable Chair, Honorable members, Honorable MECs on the call and colleagues. Honorable Chair, I'll start with oncology. Honorable Chair, in Free State, oncology, we were servicing Lesotho and Northern Cape. But over the past 2 years, the Northern Cape has decreased the number of referrals, which really had a good impact on our waiting times. If I were to make an example, some of the radical curative cases of oncology is about 2 weeks, and for palliative care is about 4 weeks, and oncology emergency is 24 hours. But we've also identified that we need to expand in terms of palliative care services. We have identified a space where we'll allocate more beds for that so that we can have more beds available for other oncology services. In terms of pathology, we did have some challenges, Honorable Chair. Honorable Chirwa is correct. At some point in last year, I think we had a labor closure of the Bloemfontein mortuary, which is now partially open. The only thing that is still outstanding is just the HVAC system, which is to be concluded before the end of June. But I must indicate Bloemfontein mortuary has a lot of capacity in terms of the number of autopsies that we can do. In total is about 200. At the present moment, we are functioning at 100. Botshabelo mortuary, it was also closed, but we've managed to correct that. It's fully functional. We also had the KwaKwa, that was last year. We had serious challenges, but the KwaKwa mortuary is also fully functional, and we also appointed additional staff so that there are no referrals to Bloemfontein. But also the Velcom mortuary, we added additional forensic pathology officers because that's our biggest, busiest mortuary in the Free State. Thank you, Honorable Chair.
Thank you, Dr. London.
Just in conclusion, Honorable Chair, if you allow,
Okay, MEC Makatsi, you can proceed.
Yes, at some point, which I think is what Honorable Chirwa is referring to, we had a waiting period as the forensic pathology of up to 3 weeks or more. But as it stands now, we have a turnaround time of less than 5 days. So I think that's what Dr. London was referring to. And the final point that I just want to make that I think Honorable Shabangu spoke to, I think we only focused on what we have been directed to, and we did not, address quite a number of issues. But if the brief wanted us to provide some kind of, health status of our Department of Health, we could have broadened our presentation. But up to now, Honorable Chair, thank you very much for the opportunity to present.
Thank you, MEC Makatsi. MEC Lihari, over to you and the team.
Thank you very much, Honorable Chairperson. Through Chairperson, let me hand over to AG and Team Northwest. Thank you very much to respond to those questions. AG.
Thank you, MEC. Honorable Chair, I will request that the questions on HIV/AIDS grant, on TB, impact on TB surveillance, and on mining, our DDG, Adelekan will respond to that. And then on referrals to Gauteng and on surgeries, DDG Pulaki Mukatsani will respond to that. And then the rest on finances, it will be Chief Financial Officer. In that order, let's start with DDG Adelekan, DDG Pulaki, and then DDG, and then CFO. Thank you, Chair.
Can we respond in that order as directed by the Superintendent General, colleagues?
Chair, Bukatsani, I see that DDG Adelakon, maybe they have a problem with the network. May I come in? My name is Polaki Mukatsani. I'm the DDG responsible for hospitals and clinical support services. The first question is whether there is an impact on surgeries because of NHLS, and the response is that in the Northwest, we do have surgical backlogs that we are at this moment dealing with. However, we cannot attribute that to NHLS in any way. Mainly the factors that we have relates to infrastructure, human resource, and increased service needs that surpasses the province capacity. But we have a program that we run even over the weekends of doing the blitz, and also being supported by some of the private facilities that we have partnership with. The other question is on referrals to Gauteng. We don't have a central or a quaternary hospital in the Northwest, I think Limpopo and Mpumalanga for now. So we refer those services to Gauteng as they are funded for that. However, in our province, for patients in Jubilee and Odi hospitals who are bordering the Northwest, we have an agreement that is regulated because we are funded for those services. So we're paying the patients that they service, which are of level 1, but there's clear referral protocols and monitoring that is being done on monthly basis. As the Northwest, we can report to the committee that in the last 3 years or so, we have invested heavily in expanding access to tertiary services and regional services in the province. As it is our regional hospitals, all of them.
Anyone here? I was like, wait a minute. Who's Dr. Mtandeni? Dr. Mtandeni? Dr. Mtandeki, please. Or can you mute that person and release the person from the meeting? Sorry about that, Mr. Polaki.
Thank you, Chair. Thank you, Chair. We have established regional services that all our regional hospitals now have CT scans. They have mammography for cancer diagnosis. We have renal dialysis. And at tertiary level, we have established neurosurgery. We have a provincial oncology unit that also have a nuclear medicine unit with it. We just installed an MRI in one of the tertiary hospitals. The other one is being installed. And we have one cath lab. We are in the process of procuring another cath lab. So we're doing this, Chair, because we understand that it cannot be correct that our patients can continuously be subjected to these long distances, and also access is quite a bit restrictive. I think I will stop there. Thank you, and hand over to the other DDG through you, Chair. Thank you.
Thank you. Can the next speaker come in, please? As directed by the HOD.
Thank you. Good morning, honorable members. My name is Tulu.
Attend to your sound issues. It's either there are two gadgets that are there with you, as this terrible sound.
At this point, it's only one, so I'll find another location. Sure.
Chair, may we request that Prof. Tumbo help as they are working together with DDG Adelekan?
Yes.
Prof. Tumbo?
Thank you, SG, and good evening, Chair and members. The question was around the issue of the mining communities with regard to TB, HIV management. I should indicate that Northwest Province has a very good relationship with the mining communities, and the 5 big mining houses have already gone into agreement with the province in terms of joint management of communicable diseases, which include TB and HIV. And we are aware that the mining houses have their own health system, which manages the mine workers. But through the Minerals Council, the mining houses have also been directed to actually provide services to the peri-mining community. So communities which are in the areas where they mine do benefit from services rendered by the mining hospitals within those areas. With regard to TB and HIV, we have agreed with all the mining houses that we use a joint, common surveillance system. So all mining houses have now adopted the same system that we use in the public sector. We report on the same reporting system, the electronic TB register, and we share data with the mining houses. We also supported their application for use of NHLS. Previously, they were actually using their own private laboratory services, and they pleaded with us to then introduce them to the NHLS services. They are billed separately. We don't pay for those services that NHLS provides to the mining houses. They pay for those separately, but whatever is done to the peri-mining communities, that is then billed to the mining houses or the Department of Health. But basically, that's a kind of working relationship that we have with the mining houses. In terms of all the other benefits that we've actually experienced from the mining sector, we know that we share data, we share facilities, and they've also assisted in construction of quite a number of health facilities, particularly primary health care facilities in the Rustenburg area and also in Dr. Kenneth Kaunda district, which are basically used by the communities in those areas. We also work together to address communicable diseases. And lastly, we are also jointly servicing the needs of individuals who are no longer in the active service of the mines, the ex-mine workers that we are tracking and tracing and evaluating their eligibility for compensation for lung diseases, including TB and silicosis, that they could have acquired when they worked in the mines in the past. So working together with the mining sector, we are basically addressing the needs of the communities directly and also the needs of the ex-mine workers that are no longer employed by the mines. The other questions have already been responded to by DDG Mukasane. Thank you very much.
Okay, thank you, Honorable Chair. It's Madire, CFO. On our side, in terms of the question the member asked about the payment plan, we have made a submission to NHLS for a 3-year plan, and then we will start paying the first payment in November, which will be 200 million. Then it means we'll be left with 400 million for the next 2 years. So if they can approve us on that one, it means in this financial year 2026-2027, we'll have paid NHLS almost 890 million, the current accounts plus the payment plan. And as we have already taken the advice from NHLS and our peer in terms of the early settlement, our approach is that one we have already done the issue of centralization. They've already sent our accounts for April. We are working on them, so we'll be loaded by next week, which means we will also start getting a discount. I think 2 months, 3 months along the way, that money will be reinvesting back into the same account because we have seen our colleagues, they've been benefiting in terms of early payment, because previously we were just paying the account and the historic debt, but because now the current account will always be behind, the NHLS will never give us the discount. But now, since we will be ring-fencing, we'll also start benefiting. And then the other aspect, the member asked us why there was this deterioration in terms of payment, because Northwest was doing well during the previous years. Our problem started in 2020, 2021. I think it's during that COVID time. I think on our side, our problem is that most of our goods and services accounts, they have been affected in terms of the accruals, because we gave the honorable members the history. So if we've got a 4 billion budget, goods and services, almost 10% will go and service the previous year's accruals. Then it leaves us with 90% of that current financial year. So it ends up affecting most of the line item, meaning the non-negotiable, even the negotiable items. So in our financial recovery plan, our focus was to look on our top 10 creditors that will start doing the payment arrangement, looking on our financial muscle. I think we looked on the account that normally attract interest. So we started with NHLS as our top creditor, and also now we have been involving our municipality. We had 4 municipalities that we are also owing, and then we looked on the interest that they were charging. So we have already engaged our municipality. I think, like example, Rustenburg, they've already responded on our payment plan. So it means also when we ring-fence all those accounts that are attracting the interest, like ESCOM, then we know we'll no longer have a fruitless expenditure on those line items, and the money that we are saving out of that interest we pay back into the accounts that we are owing. So our 3 years, honorable members must really show that as Northwest, we'll be paying our creditors so that their cash flow can improve, and also from our side in terms of the benefit of those incentives. And then the honorable members, they ask for the reconciliation that we need to submit quarterly. We'll do that because we did our reconciliation as part of looking on the account so that we can see, are we having any disputing invoices? So I think we'll start by the coming quarter, then we'll be definitely submitting to the honorable members for monitoring. But I think that is also an internal control measure that we are applying. Thanks, honorable members. Thank you, SG.
Thank you, CFO. Thank you, Chair. I think that's all. We responded to all the questions. Back to the MEC Chair. Thank you.
Okay. MEC, I believe you were in the meeting when we started. Especially when we were dealing with Gauteng and KZN. The question from my side, MEC, I just want all of you that also apply to the other one, are you committing to report to us on this NHLS payment, debt reduction and progress? Yeah, are you committing? Your closing remark must also have that. We need a commitment for you to be continually updating us on how are you settling this debt. Over to you, MEC.
Thank you very much. Commitment on how to report monthly or quarterly?
Quarterly.
We don't have a choice, Honorable Chair. So it's our job. We will do likewise.
Okay, and your parting shot?
No. Thank you very much for the opportunity. It is also an additional of a learning curve. We will improve where we're supposed to improve and keep what we are doing. We will also benchmark with other provinces like Mpumalanga and Free State. Thank you very much.
Okay. MEC Vilakazi, are you ready to respond to the issues that relate to your province?
Thank you very much, Honorable Chairperson. Yes, we will respond. I will start to give over to our HOD and CFO. Thanks, Chairperson.
Thank you, MSC. Thank you, also to the Honorable Chair once again. Honorable Chair, on the issue of our arrangement as to when exactly would we be meeting or finalizing our arrangement with NHLS, without necessarily copying from our neighbor Free State, Honorable Chair, we will be meeting or finalizing our plans by end of June this year, 2026. And also to reaffirm the committee that we, as the CFO have in his presentation, made commitment that in terms of the current account, we will be consistent for the rest of the financial year to pay it. And on the how part of it, Chair, to make sure that we pay the bill, we are working on a plan. But maybe to indicate some of the things that we are looking at is to intensify our cost containment measures, because we know and believe that we can save a lot of money from our cost containment, from a fully implementation of our cost containment measures. We're also looking at intensifying, Honorable Chair, our internal controls on the management of the service itself, because we have seen some instances where certain tests are not necessarily to be done, but let me say in general, we'll intensify the management of the internal controls on the service itself that we are rendering. Chair, in terms of any experience or any experience on disruptions as a result of apps, lack of this payment for the laboratory, the answer is fortunately no, Chair. At the moment, when the CFO was making his presentation, he emphasized the question that we were both asked by the MEC that it will last until when, that the community will stand up and cause disruptions as a result of, because it might happen that one day we might not be able to give services as a result of maybe contribution towards this non-payment of our bill. In terms of the further questions, Chair, further questions on the distance in the province in regard to the farthest towns in the province, in as far as the impact of that on rendering the laboratory service. I will give over to Dr. Kantan, to CFO, Honorable Chair, to answer the three questions that were asked on the impact of the distance in our province in our vastness. But firstly, Dr. Kantani is still, I think he went into the bathroom. Firstly, Honorable Chair, the distance, there are instances where we use courier services, where there's an absolute need. We have used courier services in many instances where there is a need. I'll give over then, Honorable Chair, to the CFO to conclude on those three questions. I've already covered the services, CFO.
No, thanks, HOD. We have engaged the medical director. The other issue of the staffing in outlying areas, we do have a outreach service by the doctors who then assist the carrying out of the laboratory tests in the facilities that are far-flung, and that where we might not be having enough staff. The other nurse-driven tests, like the TB tests, would then be carried out by the nursing staff that we have in those facilities. We are challenged, Chair, but we have interventions that are assisting the province in terms of the distances that we have. And one of the main issue is the outreach services that we are providing to the far-flung areas. We also have the outreach services in both in terms of land and in terms of air, where we are delivering some doctors to these far-flung areas. So I think we have addressed the three questions that were asked by Honorable Chiwa. Thank you.
Okay.
Honorable Chair.
Yes. Amir, have you exhausted all questions?
We have, Honorable Chair.
Then if that is the case, the MEC had me while I was talking to the MEC for Northwest, the commitment to provide us progress reports, and also you are putting a short on Honorable MEC Vilakazi. Over to you.
Thank you very much, Honorable Chairperson. Chairperson, I want to show to assure the committee that and the Honorable Chair that we will provide you with the quarterly reports on ensuring we completely pay the outstanding bill, and we will be in consultation with the NHLS in ensuring that we when they know exactly where we are and where we stand, where they can also provide some guidance in some areas. But I want to assure the committee that we are not taking this light. It's a very serious issue that is really giving us headaches, and that's why we said we really need to do different things differently so that we can see the outcomes. Dr. Kantana have just joined us because I think there was that issue that that needed him to respond to. If Chairperson will allow Dr. Kantana to just come in and assure the committee on what we are doing. Thank you.
Good evening, everyone.
Yes.
Thanks for the opportunity. Yes, I've already started today with the interacted with the manager of the NHLS laboratory at the tertiary hospital. I've looked at the April report. I will be engaging with the clinical managers and the internal medicine unit here so that we can develop a protocol. It gave me an idea that there's quite a number of tests that are requested from the different sites. But to get the reason behind it is something that I'm going into. And after I've discussed with the internal physicians, we'd probably draw up a protocol where we could limit some of the tests. I've noticed that some of the sites go to a cost of over 100,000 rand for the month of April. And I'm looking at, I didn't count the number of sites, but we're talking about quite a number of them. And I think that's probably where our cost drivers are, the tests that are being conducted, which probably not necessary. But whether they are following the guidelines, it's something else that I need to verify. So perhaps by this week, I should be able to know exactly where the problems are. But I do have a sense of suspicion that there could be some unnecessary testing that's happening. And then the next phase will be to see, I've requested one of my officials to do an analysis of identify amongst the ones that we have now in the report, which is the most costly facility that's just doing the test. And then I can zoom into it and then see, one, the clinical skill level, or whether these tests are authorized through the right process. I'm referring to whether it's an intern that's asking the test, which is supposed to be authorized by a senior medical officer. Because at one point in the past, I picked up during the weekend that some of the junior doctors were even requesting viral loads in a tertiary institution. I mean, that's totally odd. So I'm going into that, but I'll be able to, I think we'll get to a point where we could know exactly how much savings you can realize from that exercise. But already there's some suspicious testing that I think is totally unnecessary. I'll also try and go back, because we could probably look at a trend going back maybe 3 or 4 months to just confirm the findings of this April data that I'm busy analyzing now. And I think I'll have a more clear plan on how I can zoom into areas where we are having unnecessary testing.
Thank you, Chairperson.
Okay. MEC?
Thank you very much, Chairperson, for affording us the province opportunity. And as I have said, we are committing ourselves to make sure we change the situation for the better. With those words, thanks very much, HOD. I mean, I'm Chairperson of the committee and the honorable. Thank you so much.
So you'll be giving us feedback every quarter on how are you progressing?
Yes, we will do that, Chairperson.
I needed that commitment from your part, MEC. Thank you so much for taking time. Yeah, we then have to move to the last presentation for the day. Are we having the colleagues from Eastern KPA in the meeting? Yes, the MEC, she's there. I can see the MEC, she's in the meeting.
Excuse me, Chair.
Before that, can I allow Honorable Real, MEC Liari?
Thank you very much, Honorable Chair. Just asking, because of your done, can we leave to Friday?
Yeah, and we sincerely appreciate it that you still have to drive so far for the funeral. You are excused. And thanks for coming. You are excused. I think all of you, Northern Cape, Free State, and Northwest, you are excused. We are left with one province that we need to deal with. Yeah, thank you so much for attending, colleagues. You are excused.
Much appreciated, Chair. All the best.
Okay.
So my brother from Free State, you are the only man MECs.
Order, Honorable Harry, you can call each other, please. We want to. Not in this forum, please.
Okay, approach.
We need to deal with the colleagues. We need to deal with the Northern Eastern Cape presentation. The reality of this presentation was submitted given, the time the committee secretary received it. This meeting is already started. And I wonder if we started at 1, matters were going to be worse, because the presentation was sent to all of us. It's 14:20. And then I've asked the committee secretary in the morning to say, what's happening? We seem not to have the presentation of Eastern Cape. And then she's on record to say, Chairperson, I've done what I could do. I've made several follow-ups. Unfortunately, this is the situation I find myself in. MEC, are you in the meeting? Yes, I'm gonna note your hands. I've seen Honorable Mutobatse, then Honorable Mujadu, in that order. Can we? Yeah, I just wanted to confirm the attendance of the MEC in the meeting. But this is the situation that we happen to find ourselves in. Honorable Mutobatse, you can start. You'll be followed by Honorable Mujadu in that order. Those are the two hands that I'm seeing for now. Honorable Mutobatse.
No, thanks, Chairperson. We have energy. In fact, we had planned that we'll be leaving this meeting by 10 o'clock. But I think we must state up front that...
Can I just confirm the attendance of the MEC? Is the MEC in the meeting?
Yes, I'm here, Chair.
And who are the members of your delegation?
It's the HOD and the team. I think the CFO is part of the meeting as well. And DDG for clinical services is also part of the meeting.
Okay. They are all here. The HOD is here. Can I get the HOD's name so that I'm able to identify the HOD with the name?
It's Dr. Rolin Webner.
Okay. And the CFO?
Mr. Mhlanga.
Mhlanga. And the DG?
Dr. Kamlash.
And the other team members, you can mention their names if you can see them on the platform. Or the HOD will deal with that should the time arrives.
Okay.
Okay. Yeah, Honorable Mdubaz, I just wanted to confirm who's in the meeting so that for the purpose of record, also because we were never even given the list of the delegation. Also for the purpose of a secretariat for minuting. Yes, Ms. Honorable Mdubaz, you can proceed.
No, thanks. Thanks very much. I at some point, I was saying, Chairperson, that we had planned, we had organized ourselves that we'll be leaving this meeting today, 10 o'clock.
00 hours. After midnight, you're getting it wrong.
Yeah, no.
According to the program.
According to the program.
Beyond midnight.
Yeah, we had organized ourselves that, and it's not that we like it. It's not that we want to, it's Friday today. Many people are leaving, and we are preparing ourselves to go and do constituency work, including Monday. It is not by, we don't like it, just to say that. I don't know what explanation we can get from the MEC. Why is the team, I think, having this condescending, I don't even know whether condescending attitude towards the constitution, not even ourselves, because this is not actually done for our own selves, but it's towards the constitution of the republic. We've got a responsibility. We can't urinate on the expectations of our people like this, not only on us. And I'm using these ways that we are basically on the day when the biggest, I think, the highest document of the country's been celebrated, and we get this. And this is totally unacceptable. I don't know if the staff members are actually doing this to the MEC. And I don't know what the MEC would be the account or what consequence management must be taken against those. But to us, this is unacceptable. that we get a report that late. Perhaps maybe the MEC would want to respond. I will listen to what the MEC is saying, but I just wanted to say upfront that the expectation is that there's a process and there are days in which such reports must be submitted to us so that we can go through them. So the engagement with the Eastern Cape now is going to be wasting our time. I want to recommend, Chairperson, that we get this report on a day that would be scheduled, and not only on NLHS, but on a variety of issues, because there's a lot that is going on in that province based on the reports that we are receiving. That would be my recommendation, Chairperson.
Honorable Mjadu, followed by Honorable Fisani, in that order.
Oh, sorry, Chairperson, I just want to agree with Honorable Mutubadze. I don't think these people, they're taking us seriously. Eastern Cape Province, we are not going to allow them to undermine this committee. They're supposed to send this report 3 days before this meeting. I agree with Honorable Mtubatse. These people are undermining this committee, but we know what is happening in Eastern Cape. We need enough time to deal with all the issues that is happening there in Eastern Cape. But I think officials are undermining this committee, including MEC. They know the rules of the parliament. They're supposed to send this presentation a long time ago. They can't expect us to engage this presentation. We don't know whether this presentation is true, because we do our own research. We found out whether what is going to be presented is true or not. So I think here, Chairperson, these people are undermining you as a chairperson of this committee. They're undermining all the members of parliament, all the members of this portfolio committee. Chairperson, let us not allow these people to present tonight, because it must be. I think that we must write straight to the speaker and inform the speaker about Eastern Cape. There's a lot, Chairperson, happening there in that province. Corruption is that corruption. We need to ask them about corruption. A lot of things in that province. So they must stop undermining the members of parliament and this portfolio. So I agree with Honorable Mtubadze. Let us schedule other day so that they will send the report early, not like they did today. I thank you, Chairperson.
Sorry, Mujadu. I see the other end of Honorable Shabangu.
Thank you, Chair. I thought immediately after Honorable Mtubatsi, maybe the MEC was going to talk, but I realized that maybe we'll talk after we've commented. I want to agree with the honorable members that the time of sending the report it's really unacceptable. It was sent late. But I do not agree with the suggestion that they mustn't present. I'm looking at the time, and given the fact that our agenda program was planned to finish around 11 or after 11, we didn't get the report. We didn't get time to go through the report, but I wanted to suggest that they must be allowed to present. And given the time that we have, maybe they will have enough time to present the of summarizing since we didn't get the report. But they must really understand that we are not happy that the report was sent very late. And I hear that there are other problems that are there, as the honorable members are saying, but one would be interested to get the report as other provinces they've presented, especially on the issue that is at hand. Then we'll take it from there. That will be my suggestion, that they must be allowed to present. Then if maybe we feel that there's more that we need, then we can reschedule, because right now we still have time until 11. That's my suggestion, Chair. Thank you.
Honorable Sene.
Thank you, Chairperson. Chairperson, I'm going to differ with the latter speaker, and for the first time, I'm going to agree with Honorable Mutubatsi. Honorable Chair, reality of the matter is that we have received the presentation at 14:20 when the meeting has already started. And there was no way, I don't know if other members did that, but for me, there was no way that I will concentrate on the meeting and at the same time read the report of Eastern Cape. Chairperson, it's not fair for the Eastern Cape Department of Health to treat members of this portfolio committee like that. And I'm going to appeal with you, Chairperson, that we either defer this presentation to the next meeting, or we will be guided by yourself, Chairperson. But I, for one, I did not even read the presentation at all. So I want to support what Honorable Mutubatsi said in terms of either presenting in the next meeting, or we will be happily guided by your good self, Chairperson. Thank you.
Honorable Judge, is that the legacy end? Before I give the...
No,
to
Honorable Chairperson,
respond.
I just want to... I think Honorable Mtubazi proposed, and then I second the proposal. So I don't see a need to take more hands. And even the Honorable now just second. I think three people agree that this Eastern Cape
Why
Province...
didn't you leave it to the chair? Why are you speaking for the second time on?
Oh, I'm sorry, my chairperson, but it's not allowed. We mustn't allow this thing. We mustn't allow chairperson to be undermined. So the Eastern Cape, they must learn next time. If we want a meeting with them, they must send. They must send the document early before presentation, before the date. Now we can't expect the chairperson to send questions to them because we were busy with other provinces. Let us teach them a lesson so that next time they will make sure that they will send a presentation in time. Because we can't. Remember last time there was, I think there was another province send a presentation late. We didn't allow them to present. We just asked them questions because it was very late. So I think we must treat everyone the same, Chairperson. I'm sorry, Chairperson. Thank you very much.
Okay. MEC, you have heard the concerns of the members. And before I rule on this meeting, it will be fair for me to hear your side of the story. We have sent you an invitation on the 12th of May. That was 10 days. You had the whole 10 days. The rule and principle of the committee is that at least you must present your presentation or documents 5 days before the meeting. Worst case scenario, 3 days later, we still condone that. 3 days before the meeting, we still condone that. The Gauteng colleagues, as I've indicated, have since crafted a letter that I'm sending to the MEC. They did the same, but because the reason why I allowed them, because in the morning there was nothing and the meeting was starting at 2. They did submit their presentation at late at around 9 last night. So the presentation was sent late last night. Then considering that members had the whole day during the day before 1, even though they were doing other things, they could have browsed the presentations and then be able to interact with it. But in your case, remember this meeting was scheduled for 1 o'clock. The meeting started at 2. Still, there was no report. It only came in at 2:20. Yeah, then maybe there's some logical explanation, but that logical explanation should have came in since Monday, or to ask for indulgence. There's nothing that suggests that we are failing because of 1, 2, 3. There was no explanation, despite the committee secretary following up. So I should think we will love you to comment on these things before we make a ruling on the matter. It will be very important to get to give you also a hearing on this matter. Over to you, MEC.
Thank you very much, Chair. Greetings to you and the honorable members of the committee. Firstly, before I make any explanation, I think it is prudent that I profusely apologize. In no way that we would want to undermine the parliament, and it is one of the highest sittings in the lawmaking process of this country. So in no way that we would deliberately undermine. But from my side, I think I do not want to pass the responsibility, because at the end of the day, the responsibility of making sure that there's a report submitted on time lies with my office. But it was a situation that was beyond my control, that I immediately received a letter. I wrote to the office of the HOD to say this is what is needed. But unfortunately, the report was not forthcoming. I even tried to escalate the matter to DG, because it kept on saying it's coming until the last minute. I take full responsibility of the non-submission, because it is my responsibility, and I would accept any sanction given to us as the Department of Health, Eastern Cape. It is no way that we would want to undermine. I profusely again apologize. I have no further explanation or no justifiable for the non-submission of the non-submission of the document, Chair. I will end there. Thank you very much.
Yeah, but don't you see that these officials are setting you up for failure? I thought you would say, as you profusely apologize, there are steps I'm going to take, that things of this nature doesn't recur in future. I was expecting you to say that.
I would apologize, but I will do that. Hence, I said I've already started, because when I was frustrated, I escalated the matter, because I received the information from the Chief of Staff that there's no cooperation. I tried to say, I even put a deadline to say, please submit on this day, but it was not forthcoming. But I will take necessary steps. Hence, I've already started to escalate the matter.
That action that you're going to take, MEC, you'll have to copy us, because I would like you to write to us, so that even in future, things of this nature don't recur. And I'm glad also the HOD of Gauteng is still here in the meeting. is hearing our conversation on these matters. Yeah, because honestly, the reason why we have called you, because there is a problem. And if people now they want to this problem stay, because I should think then maybe under the circumstances you will be giving the members an opportunity, because now what we will want you to do when you come back, let me raise this thing with you. There's been the committee in the last term or during the tenure of before my predecessor, they visited your province. And then there were recommendations by Parliament that this province must do 1, 2, 3. To my surprise and shock, I think I attempted to talk to your chief of staff, wherein journalists were asking things that has happened in the last Parliament, which this province didn't follow up. There was a oversight. The case I'm trying to build here is for your staff, because this is the HOD and the team. When Parliament make recommendations, they must be implemented. There must be continuous feedback to Parliament. So it's like there's this culture in this province to just not take Parliament seriously. But I like it because you are saying that's not your attitude. And you've profusely apologized on the matter. And then, yeah, there are matters that are still outstanding in which Parliament did oversight in that province, made recommendations. Still, those recommendations are somewhere gathering dust there in the province. Nothing has happened. And when such happens, also, it has to deal with also the credibility of the Parliament. And as you have rightfully said it, MEC Uri, if there will be people who will be undermining Parliament under the circumstances, then we are having serious problems. And yeah, we're having serious problems, because the reason why we are doing this, we are also trying to assist you. We are not fault finders to an extent that people will then opt not to want to account to us. We are trying to, our oversight role is to show if people, they take it in good faith, it helps you to improve your systems. And I believe since you have been in this meeting, there are things that you have learned from others, and to go back home and also correct your own mistakes. That's the reason why we call you. And like I indicate, you see also the commitment of the members. I'd schedule everyone up to that date to an extent that we wanted, and members had always agreed that we need to do this work because it's our responsibility. We come from those constituencies. We are members of Parliament. We represent those people whom you serve down there in the province. And yeah, that was all about that, MEC. So I think what we'll do is I close this meeting, MEC, because honestly, we can't meaningfully engage with you. We can't. And I've already created a precedent. The team from the NHLS, I think they was in that meeting. Is it not you? I think it's them, whom I refused them to present because their presentation was late, and we went direct. If it's not them, it's the other entity in the department. They will share with you how we've dealt with things in the matters. But yeah, even now I'm saying, because we were time bound, because we wanted to deal with the APPs. That's the posture we took. Ideally now, because this is a matter that is ongoing, and because I'm even worried, MEC, whether you had an opportunity to review this report. I think you have been in the same situation with us. You were given a report, then it gets to be submitted to Parliament. I don't think you had ample time to also apply your mind on the report. At least this one now gives you an opportunity to go back. You know the type of questions that the MPs are going to ask when we reconvene. Then we'll write you a letter again on the previous committee resolutions that you need to come and give us progress report on. So it means we need to schedule another day, and then also your report will have to give us also a progress on all the concurrent responsibilities that you have with the National Department of Health. So I think these officials, I wonder that report, it will take how many days to write, but at least you know we're gonna find a date now so that you come and report to us on all those matters that you have concurrent functions with the department. Because at the end of the day, when it's said public health is failing, we know you've got those functions that are your responsibilities at the province, but also the minister will tell you, I take the blame of things that I don't have control over that are happening in provinces. So these are some of the stuff that when we meet, we'll give you a whole list of what you need to talk to, and maybe set aside the whole day, the whole day with you for a meeting so that we can deal with this. I do accept your apology, MEC, and like I'm saying, I don't think you even ever had a chance to go through that report because it was also given to you late. So it means they will go back, they will have time to brief you, and then will send you a letter also on the other matters. You remember the committee oversight that was there in the province. You will know what to do. I'm also seeing some ill-disciplined members of your management team. They are leaving the meeting while you're still there, MEC. You can see that, ne? They are leaving one by one. So that's a sign of the type of stuff that you have down there. And these are the matters that you need to take leadership and confront. Because at the end of the day, it's you who gets embarrassed, MEC. So in a way, I'm proposing a way forward to say we'll set a new date for you. Then we'll also, because you cannot solely come to us for one item. So there are matters that even members of the journalists have been asking me, matters that the committee made recommendation. Seemingly those recommendations from Parliament were never even considered. They were just shelved and pegged somewhere. And Parliament had spent money to go and do oversight in the province. And it's our expectation whenever we make recommendations, our recommendation must be implemented as Parliament. So that's the legacy report that I have to move and to make sure that it's attended. Okay, MEC, under the circumstances, I think I had 4 members speaking on this matter. And then I normally allow people to speak, not knowing that I don't know what to do, but I don't want colleagues to feel suppressed. Normally we work on a consensus basis than voting. I enjoy when colleagues persuade each other. At the end of the day, we find a solution. Though sometimes I know I'm put in a very difficult situation, but it's the situation that one cannot navigate on. But I think we felt we need to raise all these issues with you here so that even in future, we have got a rule in Parliament. Members get presentation 5 days before the meeting if you want them to meaningfully participate. That's what members do. So under the circumstances, I should think we need to still thank you for making an effort to come and attend. And then I hope you are going to brief us on the steps that you have taken, and then to show that you have indeed taken steps. Whose microphone is on? Is he or she part of your delegation?
Yes,
So,
yes.
okay. Because I see the microphone is on and we might hear things that we're not supposed to hear. Maybe it was not intentional. So, MEC, I want you to give us your parting shot, and then I'll then go. I'll have to close the meeting later. Your last bite on the matter.
Thank you very much, Chair. I really appreciate that you accept our apology, and I commit that I will write within 3 days of the steps that I'm taking in relation to what has happened, and commit that it will never happen again. I will try by all means to see to it that immediately we get a correspondence from your office, we respond on time, and we submit as per the requirements. Again, I want to apologize in no way that we can undermine Parliament. Thank you very much, Chair.
Thank you so much, MEC. I think this settles the matter. The committee secretary will get a date and check members' availability so that we can then reconvene and deal with this matter. Dr. Amban Pillay, we have come to the end of our presentation with the exception of Eastern Cape. As the national department, is there anything that you want to say? And I want to sincerely appreciate you staying in this meeting since we started with the team. I've seen Ms. Mtloti Mshwana, I've seen Lungiswa, I've seen Ujo. They've been here with us since the meeting. Yeah, over to you, Dr. Pillay.
Thank you, Chair. Thank you very much to you and the honourable members for convening this meeting. I think also it was a great assistance to us to understand what the issues are in provinces relating to the outstanding amounts owed to the NHLS, and we're hoping that through this process and the commitments that we had, that NHLS will receive the appropriate funds that are due to them, and will stabilize the organization going forward. But we look forward to continued engagement on this matter. Thanks, Chair.
Professor Mpatlele, last time I asked Jeffrey because I picked you up as professor. I hope you didn't take it in the heart because in my gadget initially, I've seen Prof. Mpatlele. Any parting shot on your part?
Yes, Chairperson. So thank you very much for the opportunity that allowed us to engage with the provinces, especially at the level of your platform. And although we engaged with the provinces before, certainly this will give us more traction in terms of the provinces coming close or honoring the commitments that they always give when the management team, visit the provinces, the HODs, and the CFOs who deal with the budgets to pay the outstanding debts. So we certainly appreciate the opportunity, and we are looking forward to see whether this will definitely bear some fruits. We hope they will bear some fruit. So thank you very much.
Yes, thank you for that feedback. It's much appreciated. Safe to say, we don't know what will be the issue and the decision in the Eastern Cape, but I should think, you know what, we'll have to engage with Treasury. It means we will have to find time soon to interact with the Eastern Cape, because also their presentation will also assist us to engage with National Treasury. You know that COCTA has managed to engage with National Treasury, and then they will always ring fence the money instead of giving the money to the province, because they rather prioritize other things than to focus on the engine, because without the lab results, I wonder what are they doing, because this is service delivery. So in fact, our plan will be for that, to engage National Treasury, so that if you don't improve as provinces, I'm glad Gauteng and the Eastern Cape, they are hearing this. But I think the progress report will determine that, because there's been commitment from all the MECs that they're going to be updating us on the progress they are making in making sure that they pay you as NHLS. Then the first progress report will be the determining factor for us to either engage a treasury to consider direct transfers for laboratory services. So we'll see what are they going to then disregard in terms of their allocation, instead of paying the NHLS, because NHLS helps the department to function effectively, understanding the role that they play. And it can't be that other organs of state, especially provincial departments, be the ones that are responsible for the demise of another state entity. So let's give this NHLS the status it deserves, because it has got a very critical role to play in the whole value chain of the health system. So, because by not paying them, you are denying the ordinary citizen equitable access to healthcare. Because so let's then do what we are supposed to do. With these few words, sometimes colleagues, let me start with the support staff of Parliament. I want to appreciate you, Zube, Vuyo, Lindo, whom am I missing? The committee assistant. For this time, you are still here. Some of your colleagues are sleeping. They are already enjoying their weekends. But you are here, so we cannot underestimate your undivided support, Ms. Magovane. Also, you, the members, it's election year. When we finish here, we must all be up. It means if you are still in Cape Town, you need to take that first flight to your constituents. So we don't take this for granted as well. The HOD for Gauteng Health, because I think you opted to remain in this meeting. And you do so, I know solely you wanted to hear others as they present, so that you can then also improve on your performance as well. And also to thank all of you. I see there are still most of you here, members, board members of the NHLS. This commitment to get things done, it cannot be taken for granted. I see majority of you are still here. So we want to thank you all. Till we meet again. The buzzword is that whatever we are doing, don't even dare take it personal. We just all understand what is our mandate as members of Parliament. And if we don't do what we are doing, we'll be failing our constituencies that elected us to come to Parliament. Remember, we are the voice of the voiceless. So always bear in mind to say, when these members, if you think they are so unfair to you, because they've got the constituencies that believe in them, that they will speak on their behalf. Okay, colleagues, you must have a great weekend if you are still going to have one. The meeting is urgent. Thank you so much.
Thank you.
Thank you,
Bye-bye.
Chair.
Thank you very much, Chair.
Thank
Thank
you.
you.
Thank
Thank
you.
you.
Thank you. Bye-bye.
Thank you, Chair.
Thank you, Chair.